we can start the webinar now. Okay, so welcome everyone to early intervention across India. Can we also, Celine, is there a way of muting the people that are in the waiting room? It's making a noise every time they're coming.
Yeah, I will.
Is there a way of muting that? Yeah.
Yes.
Thank you. So thanks everyone for joining the webinar, Early Intervention Across India. My name is Dr. Dinesh Krishna. I'm the Director of Strategy at Amar Seva Sangam Center of Excellence in Rehabilitation and Development for Children with Disabilities. Now, today we have a very exciting webinar where a number of NGOs and organizations across India will be presenting about their early intervention and child rehab model. So I'll be moderating the session. I'll be very briefly introducing each of the speakers, and we remind every speaker to try to limit to 7 to 8 minutes and allow 2 minutes of question because we have a lot of speakers. So that way we can get the program done, completed on time. So Amar Seva Sangam was founded by Mr. Ramakrishnan, who is a person with spinal cord injury, and Mr. Shankaraman, who has muscular dystrophy. So this is an organization that is run by people with disability for people with disabilities. And at Amar Seva Sangam, we have an inclusive rehabilitation model where right from childhood to adulthood, people with disabilities are provided services and advocated for across numerous ranges of programs, including vocational training, integrated school, community-based rehab program, as well as institution center-based rehab program. So the challenges at a society level is that there are more than 8 million children with disabilities in India. And according to UNESCO, 90% have no proper access to early intervention and child rehab. According to the WHO, this leads to lifetime consequences, increased poverty, and profound exclusion. The challenges at an organizational level, especially for NGOs, is there's a need gap in effective technology for gaining last mile connectivity and outreach. The bottlenecks for provision of quality rehab services are intervention planning, school enrollment, technology tools for documentation, follow-up planning, last mile connectivity, and access to health and rehab specialists. A right mix of the elements of early intervention, along with technology-enabled services, should offer required support services for government organizations and NGOs. These components are physiotherapy, speech therapy, psychological counseling, special education, occupational therapy, assistive technology, and medical surgical care. With this in mind, Mr. Shankaraman, our secretary of our organization, launched an early intervention center at Amar Seva Sangam in 2012. The center had 20 children that were attending regularly for early intervention services, and they were aged 0 to 6. However, realizing that there was thousands of more children in the surrounding community in need of such services, a CBR, or a community-based program, was launched in one district of Tamil Nadu in 2014, where nearly 700 children were reached. In 2015 to 2017, we developed the Enable Inclusion app and software solution, and our CBR program was expanded to 3 districts, reaching nearly 3,000 children. The EI app is designed for use in any early intervention child or youth rehab program. It can be used in any service delivery model. There's individualized case management, so each child has an individual profile, individual goal set, and individual intervention plan created. The EI app covers all developmental domains. It's not restricted to physical impairments or speech or cognition. It covers all domains. And we started off with age 0 to 6 early intervention, but we've expanded the app to cover from birth right to adulthood. The EI app focuses on maximizing each child's potential for functional independence, participation and inclusion, and on parent empowerment. It's a family-centered focus where the families set the goal and the therapy priorities. It follows the WHO's International Classification of Function Disability Model, the scheduling, planning, and execution features. As I mentioned, individualized goal-setting intervention planning, and there's, of course, monitoring, evaluation, and reporting features of the app. Here are the different modules. I'm not going to go in detail, but there's a screening module, there's general and specialist assessment modules. There's also child outcome modules in the various domains of development, which are internationally and nationally validated tools. There's goal setting and intervention planning module. There's scheduling and calendar modules, family outcome modules, dashboard and awareness program and capacity building modules. And of course, regular therapy and support services can be tracked and monitored. We conducted research along with global and national universities, independently conducted on the EI app-based model, and it was shown that the use of the software solution increased therapy program attendance and engagement from 60 to 95%. Child development and health outcomes were improved. School enrollment was improved. Parent strain and parent empowerment was improved. Capacity building to service providers was improved, and so was the job satisfaction of service providers. Though there was initially a learning curve for the service providers, it eventually improved their job satisfaction. In 2021, we launched the Center of Excellence for Rehabilitation and Development for Children with Disabilities. And this center provides training services both internally to Amar Seva Sangam, as well as to other organizations and to other NGOs and government departments. We, of course, provide technology solutions, including the Enable Inclusion app. But in addition to that EI app, we also provide software solutions and co-creation of software solutions to other organizations. We provide support services to our partner NGOs that have licensed the app. We provide software, rehab, and logistical support. We provide monitoring, evaluation, reporting, and research services as well. In 2022, we launched 4 versions of the app. There's a trial version, a basic version, a transdisciplinary version, and multidisciplinary version. I'm not going to go into details about the different versions, but of course, happy to answer questions and meet up people afterwards. The Enable Inclusion app and software has been licensed to 17 organizations across India and 7 states now, and 3 in Africa. So not all the organizations can make it today, but a number of organizations listed here will be presenting about their solution, and we're all very excited to hear about their program and their models. 3 government departments, the Health, Disability, and Education Department in Tamil Nadu, are also using the EI app in various districts and programs. So as I mentioned, the EI app is customizable, and it can be used in any workflow. So we have all different types of programs using the software and the model. There's community and home-based programs. There's center-based or clinic-based or outpatient department-based. There's those that are tying up with government district early intervention centers and district disability rehab centers. There's mobile clinics where mobile vans or buses are being used to reach difficult to reach communities. There's school-based special schools as well as integrated schools. And there's even childcare and orphanage programs. So the EI app and the technology solution has won a number of awards, including the MIT Solve Award, the World Cerebral Palsy Day Award, Microsoft Equal Opportunities Award, ATF Award, and many more. These are just a few lists. Since launching the Enable Inclusion solution, more than 2.5 lakh children have been screened. More than 14,000 health workers have been trained. More than 10,000 children have been enrolled with and have improved health and development. More than 28,000 caregivers empowered. More than 2 lakh people in the community would reduce stigma as a result of awareness programs. And hopefully this has led to a more inclusive society. So this brings us to Mission 2030, where our founder and secretary met the President of India, who announced that by 2030, 1 lakh children across India should be reached. Thank you very much. Happy to take any questions before we move on to our first speaker. Is there any questions, comments? Okay, in that case, I'll introduce our first speaker, which is Mrs. Deepa from Varshini Illam Trust. I'll ask you, please, because of the video and audio, please share your screen, and please keep the videos on. All the speakers, please keep your videos on when you're speaking so we can see you. And Ms. Deepa is the director of the Varshini Illam Trust, which is based in Chennai. Please take over, Ms. Deepa. Thank you.
Good evening, all. I'm so happy to see most of them, especially Chitra ma'am, Satya Special School ma'am, so great. The others, I hope in the due course of discussion, we'll get introduced. But I've heard a lot about Satya Special School from Dr. Dinesh and Amar Seva. We were always looking forward to discuss and meet you. I'm so happy to see you, ma'am, and all the others who are in a similar journey. I hope everybody. I joined a little late, so I'm seeing here Porcelli and everyone from Amar Seva as well. Great meeting you. Shall we directly get into the presentation, Dr. Dinesh?
Yes, please. Yeah, you can share the screen and please start.
We would start with the 3 minutes video, and then the balance 4 minutes we'll take it for presentation.
Great, thank you.
விதை திட்டம் மிஸ்டர் PN வாசுதேவன் CEO ஈக்விட்டஸ் பேங்க் அவர் வந்துட்டு வர்ஷினி இல்லம் ட்ரஸ்டுடைய தலைவர். வர்ஷினி இல்லம் ட்ரஸ்ட் மூலியமாக வந்துட்டு விதை திட்டம் கொண்டு வரப்பட்டது. ஸ்பெஷல் சில்ட்ரனுக்காக இது வந்துட்டு முழுக்க கொண்டு வரப்பட்ட திட்டம். இந்த அதிகமான ஸ்பெஷல் சில்ட்ரன் எங்கே இருக்காங்க அப்படின்னு பார்க்கும்போது செம்மஞ்சேரி, கண்ணகி நகர், அந்த பெரும்பாக்கம் போன்ற ஏரியாக்களில் அதிகமான குழந்தைங்க இருக்காங்க. நாங்கள் வந்துட்டு டேட்டா மூலியம் நாங்களுக்கு தெரிய வந்தது. பெரும்பாலான குழந்தைங்களுக்கு வந்துட்டு ட்ரீட்மெண்ட் வந்து ப்ராப்பராக கண்டினியூ பண்ண முடியல. அவங்களால பெரிதான காரணங்கள் பார்த்தோம் அப்படின்னா அவங்களால வந்து ப்ராப்பராக வந்துட்டு டைம் ஸ்பெண்ட் பண்ண முடியல. இன்னொன்று வந்துட்டு மருத்துவமனைகள் வந்து ரொம்ப தூரமாக இருக்குது. பணம் அவங்களால அந்த குழந்தை குறிப்பிட்ட மருத்துவத்தை வந்துட்டு ஸ்பெண்ட் பண்ண முடியாத பட்சத்தில் என்ன பண்ணுறாங்கன்னா அந்த குழந்தைங்க அப்படியே தனியாக விடப்படுறாங்க. நாங்கள் வந்துட்டு அந்த குழந்தைங்களை போய் ரீச் பண்ணி ட்ரீட்மெண்ட் வந்து நாங்கள் வந்துட்டு ஆரம்பிச்சுட்டு இருக்கோம். எங்க மருத்துவம் பாத்தீங்கன்னா வெஹிக்கிள் மூலியமா வந்துட்டு டைரக்டா வந்துட்டு வீடு தேடிய மருத்துவம் மாதிரி நாங்க வந்துட்டு இலவசமா இந்த திட்டத்தை கொண்டு வந்ததுனால ட்ரீட்மெண்ட்டும் இப்போ நாங்க வந்து விதை மூலம் நாங்க வந்து பண்ணிட்டு இருக்கோம்.
வர்ஷினி ட்ரஸ்ட் உள்ளே வந்தோடனே நாங்கள் இங்கேயே பண்ணிக்கிறோம். எல்லாமே ஃப்ரீ ட்ரீட்மெண்ட் தான். இப்போ என் பையன் இந்த ட்ரஸ்ட்டில் நல்லா ட்ரைனிங் கொடுக்குறதுனால இப்போ என் பையன் நல்லா நடக்கிறான், பேசுகிறான், எல்லா ஆக்டிவிட்டிஸும் நல்லா பண்ணுறான் என் பையன்.
இது வரைக்கும் பயன்பெற்ற குழந்தைகள் பார்த்தீங்கன்னா 60 குழந்தைகள் வந்து இதுவரை விதை திட்டத்தில் வந்து பயன்பெற்று வராங்க. 2023 ஆண்டுக்குள்ள 150 குழந்தை நாங்கள் வந்து ஃபோக்கஸ் பண்ணோம். ஒவ்வொரு குழந்தையும் வந்துட்டு எங்களுக்கு ஒவ்வொரு விதை தான்.
Yeah, so Varshini Illam Trust, we started in the year 2014 as an adoption center. The adoption center is located at Annanagar. So far, we have been able to give a home to 50 plus children, both nationally and internationally. So we've been, approved by Kara as well as Sara, and the journey of Project Viday actually started from the adoption center. It's very important to talk about an adoption center and then go to Viday, because the seed actually started from there. In the year 2021, we in fact got a child with CP level 2. And we had to spend close to about 60 to 70,000 on his therapy for about 8 months, and finally he got adopted to parents in Italy. So that's when our founder, director, Mr. PN Vasudevan, and his daughter Varshini thought, what happens to all the children who are there in slums who cannot afford to that kind of an amount? And that's when the research for what can be done and what are the kind of models available right now, everything started. We met all the stalwarts who are doing the work, like Jayashree ma'am in Sebastian, and then we went to Vidyasagar, went Vasantam. So a lot of NGOs we met. We went to NEET-Med, we went to the disability department, welfare department. So we found that there are multiple models available. There was mobile therapy. Somebody was doing mobile therapy at some point of time. Someone was doing, home-based therapy. But everywhere the dropout rates was close to 90% in terms of children not, parents not bringing back the child to the, to continue the treatment. So then we decided, okay, mobile therapy is going to be the model that we will be following. And we again, went around researching and found out what should be not done and what should be done so that this model is successful. As all of you know, it's a very resource intensive model. So we decided on the therapy on a mobile van. We bought a chassis and then we built the van. So that's one thing which we were very careful. We should be, designing it in such a way that it solves at any point of time 3 therapies can be done inside the bus. And we avoided all that learning that we had from the other people who said what can possibly lead to a mobile therapy model failure. So we included those learnings also while we were devising. So this is how our bus looks like, the inside of the bus. We have 2 such buses right now, and we've ordered for another 2 more. So by the end of 2024, we will have 4 buses in our under us. Now, this is the data in terms of the total screening. We have screened close to about 14,000 children. We have 160 children right now under therapy. About 127 are under high risk. And the other program parallelly that we run, the parent counseling that happens, the medical intervention that who all have moved. About 15 children have moved and moved to regular schools or special schools after moving out of our system. Now, since this is very much towards EI app, the advantages and disadvantages, since we've been using the app for last 1.5 years, it has been very helpful. The slide is very self-explanatory. I can always answer any doubts probably on that, but it has been a one-stop solution for us, and and we are able to track the child right from the time they've come into and then they move out. And our learning has been really been driven by the EI app team in Amar Seva. It's been very helpful. So it all depends. If you are not utilizing that team, we won't be really able to make much of a progress in the whole thing. So we keep as monitoring the KPIs, and we make sure that our team improves the performance indexes, whatever has been shared by the Amar Seva team. So we basically have a very open communication channel between both, and has been helpful for us to be successful in this particular model. This is a therapy. We cover almost all the therapy, in the disability spectrum. Only visual impairment, VI, we don't handle, but all the other area we cover. This is the model. You are all again aware of it. It's a CBR model. We have community rehabilitation worker, then we have physiotherapist who does therapy, and then that's the only change in the CBR model as far as Avvai is concerned. And then we have a program coordinator who runs it. Today we are present in 4 blocks or 4 divisions, the Tamil Nadu Urban Habitat Board, and we have slowly expanded to Chengalpet district. The government of Tamil Nadu, in fact, has given us a small therapy unit inside the government urban public health center in Kannagi Nagar. There we do basically neonatal screening and vaccination screening. This is the other activities that we basically do in the field. There's a lot of interaction which happens with the parents, and we also arrange psychologists and neurologists consultation on a time-to-time basis to for all our service users. Again, assistive devices is something that we very closely monitor and do. We have provided so far about 35 assistive devices to our service users. And that's it. That's
great.
us.
Thank you so much.
It was a little difficult, but I think I covered everything.
No, that's wonderful. Thank you. And I, having personally witnessed the work of Varshini Illam in their mobile van, can attest to how amazing their services are, reaching the urban slums in very difficult to reach areas in Chennai. So, really commend your efforts. Now, we want to make this as interactive as possible. So if people have questions, please, we'll take a couple of minutes to take any questions.
I've also got my program coordinator, Suresh, with me. So both of us would be taking the questions.
So please, if there's any question, or if you type any questions, I can read out the question also. We can do that. But if anyone wants to unmute and please ask any questions or make any comments, that'd be great. Madhu, please.
Yeah, shall I?
Yes, please, Madhu.
Yeah, just the question, like you are in the community in the bus, right? So the data entry, everything is done on a mobile app, or you're using the desktop in the location?
No, everything is done on mobile app.
Okay, it gets updated immediately, or the users have to come back to the center and then backtrack the data? And
every evening before 8 o'clock, they're supposed to update. While doing the therapy, the therapist is supposed to update in every therapy. So they have to check in and check out. They do the check out. Once they complete the therapy, if they start the therapy, they used to check in. And once they complete therapy, they used to do the checkout. So every therapy.
So the checkout part, see, I've seen the demo of the app. Okay, I just want to make it clear, like check-in they'll do when they're seeing the patient. When the bacha comes to them, they'll do the check-in and then do the therapy. They go back to the center, update the record, and then check out. How does the process go?
No. In the bus itself, they'll do the check-in and check-out for a patient, for a child.
Okay.
Through mobile.
Through mobile.
Okay, through mobile. The previous appointment is not given. The bachas come to the bus. They do the check-in and check-out and the therapy, and then they do the update records after going back to the centers, right?
If there's internet connection,
automatically updated. Basically, it need not be, we need not go back to the center and update it. It gets automatically updated once the process is over.
So the bachas, every record of the child is there on the app. That's what you mean. They have an access to that.
Absolutely, yeah.
Even if you're offline, even if there's no internet, it gets recorded, and when the phone comes online, then the data gets pushed online. So even offline,
like an email portal.
That is recorded.
Yeah.
Yeah, in
Similar
the
to an
mobile
email
application, they can see all the servicer records and their assessments, everything they can see. And based on that, they can do the interventions and they can do the check-in and check-out. So all the things they will get in the mobile app itself.
Okay.
And
Thank
Madhavi,
you.
if you want to
Bharat
say
Satya.
customize the data towards, like, suppose you want the data in a particular format, because we had found that if it is available or the pivot table is available in a particular format, it'll be good. So when we suggest that to them, they automatically customize it, one or two, which can be easily done for us. So that's also possible. You might want to see the data in a particular format.
Yeah. See, for me, the kids come for 3 special ed. As you said, 3 therapies. They come for occupational therapy, they come to speech and special education. Okay. The bus is a different idea. They come to my center. If I'm going for a community, it's a different program itself for me. Now, at this point, this is my intention. So once I open a slot, once they are done all the 3 therapies only, I can close. So the whole data goes into the kids record and gets updated, right? For me, I don't know how many therapies your kids go in, like half an hour ka therapy slots I have. They finish all the 3 therapies and then they go out. So I have to update all the 3 records for them once they are in the center. So that's what I want to do, make sure. So that has to be customized for my requirements then. Yeah?
Yes.
Got it.
Madhavi, which organization are you from?
I'm from Vatsalya Trust in Mumbai. We had a demo last week.
Wonderful. Bharat asked a question to Deepa ma'am and the team. Is there any certificates required to run the community bus, the therapy bus? Is there any permissions or certificates required?
No. There is no. There's only the basic transport commissioner approval which is required, which is available in every regional transport offices. It has to, the mandate is that it has to be within the transport, commissioner or the RTO, whatever are the motor vehicle rules present in that particular state. So it has to abide by that. Then the registration approval gets done. That's the only thing that you have to take care when you are building the van and getting it. Finally you have to go for registration. They'll inspect the vehicle and give you the permit. So it has to mandatorily follow all those rules which is written in the Motor Vehicle Act. Otherwise, no other special approval needed. Approval is needed to do the community-based rehabilitation program from the Disability Welfare Department, which we have got.
Great. Okay, I think we can move on to the next.
I do have a question. Myself, Sudeep Goel from Sudeep Goel from ASHA Kashana, Rajasthan. So, what is the your commendable work you are doing? Congrats to you.
Thanks.
Just wish to know that which are the transdisciplinary approach you are focusing on, like which type of therapy and how long is the therapy session, particular therapy session, like 45 minutes, 1 hour, which type of therapy exactly you are doing and for how long?
Yeah, so therapy duration depends on a case-to-case basis. I'm sure you're aware of it. So it can be anything between 20 minutes to 45 minutes, depending on what therapy is it, whether it is speech, whether the child is cooperating to the therapist at that point of time. So it varies on the user basis. But we have mandated that any therapy cannot, go lesser than, say, we have some SOPs in place. So if it goes, below that, the therapist has to probably explain as to why it was, done and all that. So systems are put in place so that, everybody gets a minimum attention, because it's a community-based model. We have a lot of children coming in. No child should or parent should feel that, no, I was not looked up properly.
So, linking to that, like what is the average duration, intervention period? Like if one child is getting therapy, say 2 or 3 therapy every day. So it's a duration is like he will be getting the benefit every day or alternate day or how?
No, so every child gets 2 days therapy in a week per week in our bus, and 2 days are done at the home by the parents. So we monitor that. You might have seen that book. So we monitor that, and then get it signed as to what is done when the parent brings back the child to our bus again the next week. But mandatory is 2 days therapy per week each child.
Okay, great. Thank you.
And we've been, looking at transdisciplinary approach. We are looking at Amar Seva also to guide us probably on that approach, because there are different schemes of centers of excellence which probably doesn't like we operate with MRF for speech and language. They're not very happy about the transdisciplinary approach. So we'll have to probably look at options where we can bring this together and finally give a transdisciplinary approach to the end user.
Yeah, we've been working closely with Varshini, Illam, trying to refine the transdisciplinary approach. In the interest of time, we'll be moving to our next speaker, Mrs. Chitra Shah from Satya Special School. Ms. Chitra, do you want me to share this? She's the director of Satya Special School. Do you want to share this screen? Yeah,
I
great,
I can do it. I'm fine.
Thank you so much. Thank you.
You're able to see it?
Yes, we can see. Yes.
Yes. Okay. So good evening, everyone. And I think really a huge thanks to Amar Seva Sangam. I always keep thinking that we do so much work, but then there is not much scope for networking among organizations. And I see this as a very good exercise. And thank you, Celine and Dinesh and all of you at Amar Seva for having put this across. So Satya Special School is actually a 20-year-old organization. We started off as a very, very small program in 2003. And over the years, the idea is to give a very comprehensive rehabilitation setup for the people of Pondichery, both urban and rural, but that's where we work. We also have branched out to satellite centers in the neighboring districts of Tamil Nadu. The idea is that anybody who walks in gets the services that the child is needed. Most often, it is very, very individualized. And I think because of the interventions that we have given, we are now setting an example for what we call meaningful, sustainable inclusion of children with special needs into mainstream schools, both government schools as well as semi-urban private schools. We still haven't been very successful with urban private schools. Our early intervention model actually has like 3 or 4 parts. One is a hospital-based setup, which is the neonatal high-risk clinic at one of the largest hospitals in Pondicherry. We have center-based programs, both urban and rural. We have 2 mobile units, one which is a therapy unit and one which is specifically a sensory integration modified vehicle, which only provides sensory integration. And given, I think, the geographical needs of Pondicherry, the socio-economic needs of Pondicherry, we have now also branched out into genetic counseling, especially for families who have a child with a special need and wanting to have a second child. So at our newborn high-risk clinic, I think we started this in 2016 at the JIPMA pediatric ward, where we have a tie-up with the University of Oregon's early child care program. We start identifying children at risk at birth. We have a checklist, delayed birth cry, congenital heart issues, I think low birth weight, sometimes issues in the delivery room, and start tracking the development of the child from the day they were born. So depending on the needs of the child, sometimes they come once a week, sometimes they come once in 2 weeks. And then I think once we know for sure that there's been a delay or there is a risk for a delay, we start our intervention with our team. So it's both a medical model as well as a rehab model. It goes hand in hand. And all the services that are necessary, be it cleft palate, we have Project Smile there. They do surgeries wherever there is corrections necessary. And then added to it is all the other intervention services that our team provides. The center-based started in 2013. We first started with one urban center. Then we realized we had rural centers where there were children with special needs. So we set up the entire early intervention program there. The youngest who comes to Satya is now a 2-day-old baby. And we have like 125 children across these 4 centers, catering to predominantly Pondichery and its surroundings. Occupational therapy, hydrotherapy, speech, I guess all. And I think one of our biggest programs is what we call an early stimulation lab for all children that go through our newborn high-risk clinic. And off late, we see a lot more need for it, especially when the parents are working and there isn't anybody really focusing on, their needs. So that's an early intervention early stimulation program. And one of our biggest, I guess, learning and strength has been using the mothers as co-therapists. We insist on the mothers spending, at least when the child gets admitted, the first 6 months, a minimum of 2 to 3 days a week in our center where they can learn, where they can understand, and where they work in collaboration with the therapist on what is to be done. I think the success of this is what we saw during the COVID, where we didn't get any panic calls. The mothers knew what is the schedule to be followed, what has to be done, what next, how they can support their children. So I think that's been one of our biggest achievements. This is our mobile unit. We've even got an award for it being one of the most successful community rehab projects across Asia, way back in 2014, I guess, from the Cerebral Palsy Foundation, the World Cerebral Palsy Foundation. We do home-based intervention. This is, again, rural areas where accessibility is an issue. Sometimes the team has to carry the equipment and literally walk. Nothing is done inside the bus. It's a very small van. It is only used to carry our therapists to the doorstep. The advantage being, once our interventions are done, we've been able to integrate a number of these children, enroll them, integrate them successfully into the neighborhood government schools. So while the vehicle goes into the village, we also have a discussion parallelly happening with the local village school there to talk to them about inclusion and why is it important. And that relationship helps us later when we try and enroll our children into the schools. This is something that was started just last year. The reason being, we found a number of children needing or having sensory integration issues. This is an ambulance that has been modified. It's solar powered. It can, kind of function everywhere. It's divided into 2. We have a dark space for light and sound stimulation. And we also have enough therapy space along with the swing for vestibular stimulation and OT, along with her team of assistants. Go there. What we do ideally is to go and park this vehicle in the PHC, and the mothers from the village come there for like half an hour of therapy once a week. And then we have something called the community resource assistants, which are basically moms who have been trained to act as therapy assistants, and they follow the schedule along with the mothers, or sometimes whoever is a family member. This is how the inside of the sensory integration unit looks like. And I think as of now, we have about 326 early intervention children every year. So the number keeps going up because we do have, and our follow-up rate is as high as 85% in the newborn high-risk clinic, and in our centers it's as high as about 92, because Satya is the only early intervention center in this part of the country. So why did we even go to the inclusion app? We've been looking at a number of facilities, a number of technology tools that are available. We tried Gunjan, we tried some of the others. Because we have a large number of children, tracking their growth, and every time a donor comes and asks, how do you tell me that 2 goals are achieved or 4 goals are achieved? Somebody who has joined me when they were, say, 2 years or 2 months to now when they are 8 years, the IEP file itself is so thick, and going through tons of paper didn't make sense. So that's why we were looking at a technology interface. And I think we've done thanks to Dinesh and his team, we've been able to customize not just the demographic profiles, but also in terms of the checklist, in terms of what we needed as goals inside, in terms of the activities that support the goals. We've modified it, we've customized it for our convenience, because I think our educators and therapists are used to a particular kind of checklist, and to be modifying or changing it now because the app gives you that was difficult. So when we discussed it, Amar Seva team was really, really obliging, and we've done a whole lot of customization. Just started using it, I think, since August or September. So we still not even done our first intervention, first evaluation. We're still waiting for it, maybe end of Jan. As on date, about 500 children's data is already in place there, and we will be implementing it. We're starting a new project in a place called Karaikal, which is one of the territories of Pondichery, and also going to have a mobile unit there. So we would be introducing the app right through as we start our operations in a new center, and I think it should go smooth. Satya basically networks with a whole lot of organizations. If any of you have heard Project Inclusion, they also have an app. So Amar Seva Sangam is actually, we have helped them tie up with Project Inclusion to see how we can get on to one common app across all the projects. The Hans Foundation again also has another app for inclusion. So trying to see and take out the best of all these apps that are available and see if that can be customized for the support of all of us. We also have a mentoring program. We're trying to get lesser known from lesser known towns and districts, people working in the field of disability, to move from the charity-driven approach to a more, rights-based and need-based approach. This is basically what Satya is doing. Thank you very much. And if you have questions, I'll be happy to answer.
Thank you, Ms. Chitra. Wonderful presentation. I also was able to witness the work of Satya Foundation in Pondichery last year. And, we are talking about models here, and they've integrated so many different types of models. Mobile clinic, I didn't realize they're doing, as well as a school-based, a center-based, working within the hospital setting. So I'm glad that you've been able to expand so much and use the app to cover all these areas. People can type questions, or they can just unmute and speak or raise hand. All are okay options.
Great, ma'am. I think it's a wonderful, glance through the whole project. We are so close, but I feel that I have never come and, met you. I think the first thing probably next week or next to next week, I'm going to see you is, we coming over to you and then meeting you in person. I'm sure the learning will be abundant, and we and our therapists are going to definitely benefit a lot, ma'am. Thanks so much for that presentation and all the work that you're doing.
Anytime. Thank you.
Very good presentation, Chitra ma'am. Thank you so much.
Thank you, Kalyani. Thank you. Thank you, Dinesh, for helping us share this. Thank you.
Oh, wonderful. Yeah, thanks so much. Okay, so if there's no questions, we'll move on to the next speaker. We have Mrs. Kataki is the director of Shishu Sarothi, based in Assam. So we've had Tamil Nadu, Pondicherry. Now we're moving to the northeast to Assam. Mrs. Kataki, please let me know if you want me to share screen, or you'll go ahead. I think you're muted now.
I'm going to try sharing screen, and if I struggle,
then I
think you can switch in. Yeah. Can you see my screen?
Yes, ma'am. Yes.
Yeah. Hi. So, which is 7 years old. We started with just 2 children in 1987 and have come a long way since then, and are working towards creating an inclusive and barrier-free world for all, with a focus on children and persons with disabilities. We have a vision of an inclusive world, and our thematic areas, our vision, mission, I guess we all have similar visions and missions, so I'm just going to skip that. Thematic areas are basically service delivery in the area of health and education. And health, when we say health, we talk about early intervention, home management, referrals, and counseling. In education, we work on school readiness. We provide a special education. We also have inclusive early childhood education and provide vocational training, and also have a Rehab Council of India approved training program. In awareness and advocacy, we do a lot of work on legal literacy of rights for rights holders and for duty bearers. We try to work on policy advocacy. We do a lot of legal counsel and litigation support for addressing grievances. And we also do access audits in our capacity as empaneled access auditors with the Accessible India campaign. And we try to do small research studies from time to time on different issues to create empirical evidence and to try and influence policy. Our work in the area of early intervention, which we've been offering this service since inception as an outdoor service for children with disabilities. And over the years, the age of the children availing these services has gradually started to come down. So we're actually doing early intervention in terms of attending to infants, high-risk babies, and children with developmental delays and disabilities. We operate from 6 different locations. Our team has regular services at 2 locations in Guwahati. One is at our center, and the other one is at the Composite Regional Center in Guwahati, which, because of its proximity to the Guwahati Medical College and the pediatrics department, gets a lot of referrals of very young babies from the NICU at the medical college. And for the last 3 years now, we've been also located at the outdoor service of the pediatrics department in the Assam Medical College Hospital in Dibrugarh as well. Apart from that, our team travels regularly. In fact, my colleagues today are probably on their way back from Gwalpara in West Assam, where I know that they have 21 children attended that service there. Twice a month, a team travels to Golaghat district, where we work at the District Early Intervention Center within the civil hospital there, as well as a local hospital of a company in Golaghat, in Numaligarh itself. Twice a month, the team travels to another neighboring district. So there are basically these 6 locations. We reach about close to 2,000. I think last year we reached about 1,900 children during the year 23, starting from, what was it, April to March. These are just some pictures of the team working in the different locations. Yeah, that's 1973 children reached, about 1,500 new children, and another 500 previously enrolled children whom we followed up with from the different locations. We looked at deploying technology to track and monitor our early intervention services. And I've been talking to Amar Seva Sangam since 2021. And we have, my colleagues have, it was a shaky start, but when we, to date now, we have 196 children's details entered in the app. And with the evaluations that we've done, we've noticed that many children, there has been significant improvement, and more so in the younger children. Our experience with using the app is mixed, in the sense I'm not sure whether, you know, whether it was because we were not able to sort of match with the exact way to work, but I'm very grateful to Amar Seva Sangam for constantly being there. The usage and make it more user-friendly for us. And in fact, from this year, we have changed the version that we are using, and we are hoping to use a version that will be more easily usable by everybody in the team. And I'm really hopeful that because the app uses standardized tools, we'll be able to actually effectively talk about the improvement. We know that there has been a lot of improvement because of the intensive work that the teams are doing, but this app will go a long way in sort of helping us document that further. In addition to that, we have a range of education-related programs. We run a Center for Inclusive Education. We have a scholarship program, training. We do specific projects on inclusion and so on. And we have a project for working specifically with children with deafblindness, with support of Sense India now.
Hello.
At our center, we do school readiness. As I mentioned, we have an inclusive place school, and we do special education, of course, and we have a focus of doing work with children and young adults with high support needs. And these are just some pictures of various events and programs that we have. We lay a lot of emphasis on ensuring inclusion and full participation of our children in different programs and activities. At the work with the deaf-blind is also includes, sorry. Oops, I seem to be going back. Yeah, center and home-based work, a lot of emphasis on independence in daily living activities, orientation, mobility, braille and sign language training, participation in network meetings to build confidence and engage with others and create a movement. And of course, ensuring exposure to varied experiences and events, sensitizing different stakeholders of the acute and extraordinary nature of the disability. Vocational training is another area that we do. Our main focus is on papercraft work, but we also do diyas and costume jewelry. And we've also initiated some work in vermicompost and mushroom cultivation lately. We implement a scholarship program for students with disabilities to support them to pursue higher education. And we do this across all 8 states of Northeast India, with the support and in partnership with like-minded NGOs in each of these states. Our training department runs RCI recognized courses, the Diploma in Special Education, and the Community-Based Inclusive Education Program. And apart from that, we'd also do a lot of customized programs. We do a lot of trainings for Samagra Siksha in Assam. Right through the year on different aspects, we work with their inclusive education teams, and we are also, through other parallel projects, working actively with school teachers in different districts. We implement a program called the English Access Program, which is supported by the US government. teaches English language on weekends to students from disadvantaged and difficult sort of backgrounds. And so far, we're in the second cycle where we are working with about 50 students, 25 in Guwahati and 25 in Shillong. We also have a lot of interns and volunteers and researchers that are constantly coming to us from a lot of the local universities and in educational institutions in Guwahati. We are very hopeful that that exposure that we can provide them will help create more people to work in the sector. The inclusive education programs, specific projects that I mentioned, one is a program in our district, which is Kamrup Metro, where we work with 10 schools, and we are trying to create a compendium of universal design of learning-based lesson plans in different languages in Assam for the primary school level, which the government school teachers could use to good effect. And it could be, a valuable resource for other teachers in the system to ensure that children with disabilities are also included. And it addresses, basically, the focus is on addressing the diversity in classrooms. We also work in another district called Karbi Anglong, which has now been bifurcated into 2 districts because it's a hill district with poor communication facilities and very inadequate infrastructure. So our teams are working there, actively engaging with the communities there and working with the schools, the school teachers in the schools, the school systems, and also with the children, setting up child rights clubs and trying to build confidence and nurture self-advocates amongst the children. Our awareness and advocacy program has been a unique program via a project called a disability law unit that we've been running for 2 decades now, where we do, as I mentioned earlier, rights awareness. We also do access to justice by way of legal counsel, litigation support, supporting the government in ensuring appropriate documentation of testimonies of victims. And we are also focusing a lot on working with women with disabilities and ensuring that trying to constantly keep disability bring it to the forefront rather than where it tends to be in the back and, in the back burner most of the time in terms of policy, in terms of government's viewpoints on it. So rather than be an afterthought, to constantly trying to see that it's discussed and issues around disabilities are always highlighted in the media and so on. We do, as I said, small research studies from time to time. So this was when we released a study report on a study that we had done on the reach and implementation of government schemes for persons with disabilities in Assam last year. Yeah, this is in a nutshell the best I could do to summarize the range of work that we've been doing. I'm not sure I've done justice to the considerable body of work, numbers, and so on. Perhaps if for anybody who's interested, I could share more information. Thank you.
Thank you so much. Yes, I'm sorry that I gave everyone such a short time limit, so it's hard to comprehensively cover all the great work being done, but that's really comprehensive, the work done by Shishu, and we're very excited to be able to work with Shishu Sarothi. And is there any questions from Mrs. Kanaki? You can type it in the group chat or unmute and ask. And Yeah, and Kataki brought up, we did change over the AI app model from the multidisciplinary to the transdisciplinary version. So with the transdisciplinary, there's only one comprehensive evaluation tool that covers all the different domains of development. So we're hoping that will ease the burden on the workers that were using the app that found it, that it was a lot of work. So with this, it should be a much smoother process. So thanks for bringing that up. Is there any questions from the audience? We'll take a couple of quick questions and then move to the next speaker.
Yeah, can I ask another question, please?
Yes, please.
Ketki ma'am, you have a huge data, like 1,900 kids in the past just 1 year, you said. May I know just why 196 only you have used on the EI app? Is it due to the time conservation or?
Yeah, primarily that. So we do we also had wanted to test it out and see if the focus initially was on trying to track children who are coming regularly and to sort of, be able to monitor that progress, as it were. Whereas a lot of children do come because we go to them in the outreach programs, we go there, but it's still very institution based. We're not going into homes. For instance, where we're not doing community-based work, if what is understood as CBR as such, it's still very institution-based work. So if the child doesn't come back to us, we are not able to monitor that as closely. So we picked and chose children, so to speak, initially. But now I think with the newer version and the newer model, we are looking at putting in the data of as many children as we have, so that the documentation is there in any case. So this deploying of the app is something that we are still sort of finding our feet, because the therapists are so busy with services and the numbers are so huge, particularly in the hospital setting. They don't have the time to pause and take down a lot of details, because there's a huge queue of children waiting outside, for their session, so to speak. So we had to pick and choose fewer children from those settings and so on. So these were some of the practical problems that we faced, and we were still a little tentative about it at the time. But I think my team, the therapists also have now sort of are feeling a little more confident about it. So it's taken us a little time. I'm hopeful that we'll be able to use the app more effectively and sort of for it to give us the kind of results that we're looking for in the coming years. Yeah.
Yeah, we've told the Shishu team that it takes time to put all the data in, but you can still put the basic data and have a database with everyone. And those children that are getting regular follow-up, they can have the more detailed assessments and things done. So
I should be able to segregate, right? Who is the continuity? Because it will be easy for me to track also. Like as the previous person said, 90% of the kids, they are in the therapy. The remaining 10 drop off or whatever. So it's easy for us to track how many screenings I did, how many are in continuity, the progress, and it's easy for us to track. So
exactly.
And then in Guwahati, what happens is the children who come to us, and most of the data is of children who are coming to our center in Guwahati itself, in our own premises.
Yeah.
Because the other places, the rush, there's too much of a rush, and it's harder for the team there. So the thing is that once they're there with us for over a year, if they're Guwahati based, many of them are referred to our own Center for Education, which is, so the outdoor service or the early intervention program is an outdoor service. And then they refer to the center. And once they refer to the center, they kind of go into another department, if you know what I mean. So they're not, we're still trying to figure out that integration.
It will be regular, like a school, and continuity will be
Yes.
there. They'll be
Yes.
permanent
So,
there.
yeah. So then we were struggling with this every day for a special educator in that classroom to do check-in, check-out of that child. It didn't seem practical to do that. So
Correct.
those were some of the glitches that prevented us from tracking the children, although there was progress, obviously, because they moved from one service to a regular, and they were in a education setting and everything. So those were some of the issues we faced.
Thank you, ma'am.
Yeah,
Thank you.
yeah, that's a good point. So we have a few special schools, and the checking in, checking out of children became a bit cumbersome. So we're actually going to be launching a new attendance module specific for special schools. Hasn't come out yet. Actually, that's a good segue to our next speaker at ASHA Special School, Mrs. Priya. She's running a special school program in Special School Center in Bangalore. And these are one of the recommendations they've made. So we're going to be updating the app with where all the children can be checked in and checked out. So it's more like an attendance module. So anyway, I'll leave it to Mrs. Priya. Please go ahead. You can share screen and start.
Yeah. Thank you, Mr. Dinesh. And thank you, the Amar Seva Sangam team, for collaborating this webinar. It is very heartening to see such a big number of organizations, NGOs who are working for the disability sector. The screen is visible, right?
Yes, we can see.
Yes, ma'am. Yes.
Yeah. Okay. So ASHA stands for Academy for Severe Handicaps and Autism. We work for people with autism in the age group of 3 to 18 years old. We have been providing intervention services from 1995. We are close to 30 years old, and our student-teacher ratio is 2:1. We try to provide all the services needed for a particular student and the family in the same place. So that makes life easier for the families, especially with people with autism. So what autism is, it's a neurological disorder where language and communication is a big challenge. In addition, they have a lot of repetitive behaviors, very specific interests. And what we've observed is intense, focused early intervention makes a very big difference in development and including this population in the mainstream environment. So that is where we are trying to do our best. Right now, the current data says 1 in 100 children have autism. Yeah, like each one of us, we have our mission where we want to provide the best care, hope, and assistance to children with autism to utilize their potential. So we start with screening and assessments. The need for this is every student, every child with autism comes with his own developmental areas and delays. So to understand where he stands in terms of development and what is it that he needs in terms of training and guidance is what the assessment tells us. So we start with assessments for each student that comes to ASHA, and these assessments continue every 2-3 years to understand how much he has picked up over the period of 1 or 2 years, and how is the learning going to happen, and what are his goals going to be for the next years. So for the age group of 3 to 6 years or below 6 years, we have an early intervention program. So this has been a very a program that has actually worked very well. This is a mother-child program where the mother is a co-therapist. She is trained by the therapist to work with the child, to understand his goals, understands his deficits, and work with him. The major challenge with autism is they don't generalize their skills. So here the mother is important in learning and teaching him in school and carrying the same information, same training back home. So it also helps in training the family there and bringing about that bridge and learning between the school and the family and home. So this project is about 5 to 6 years old, and we are doing really well to the extent that many children are ready for inclusion, and we try to try to include them in small preschools or inclusive ready schools. For the students in the age group of 6 to 18, we have a day school program where they learn different therapies and everyday special education, like academics, like a bit of motor skills, speech and language is important, physiotherapy, OT is all that is provided to them during the day over a period of time. And in addition to learning, after about 14 years of age, their life skills and vocation skills take up importance. And that is when teaching them pre-vocation skills and everyday living skills is important for them to keep themselves engaged, to make themselves productive, and not be depending on any of their anybody in the family. In addition to other therapies, we try to provide art, dance, yoga, and sports to all of them. The idea is every student needs all of this, and wherever he's good at, then we can try to provide better therapies, better support for him to improve in the area of interest for him. So in addition to providing education to children with autism, we also try to consult mainstream schools to provide inclusive programs where these children could be included as early as 3 years, when the school starts, so that inclusion is part, and the school also is sensitized towards having an inclusive program. Having a special child at home can be extremely psychologically draining. So that is when parent counseling is important, and teaching a child with autism is extremely difficult. So yes, as teachers do their job, but it is very important that parents also understand how to train, how to teach the student, how to learn with him, and how much learning is needed for them. So that parent training is equally important to us as much as student training. Given a ratio of 2:1 and extremely financially draining services that a family with autism has to go through, and invariably it's a mother who has to give up her job, who has to give up all her activities and focus on the child. It happens that she just stays at home and gets into gets into a negative mode. So that is when women empowerment, where we focus on ways of empowering them financially and in terms of skills, so they are able to pick up something, and in the course of time, maybe their child also will be part of the same enterprise that they are planning to start. So now in terms of women empowerment, we have a small group that has got into cooking. You see a group here that is into textiles, block printing, and many other areas like this. So keeping inclusion in mind, the need of awareness and sensitization in the mainstream schools has been very important. And since we are also advocating it, we go to nearby schools in Bangalore and try to provide awareness about autism to the students there. The reason here is autism is not a visible population. There may be a number of children, and they may be just labeled because they act because of different communication difficulties, sensory difficulties, not able to express. These people may be just made fun of, and many other things which could be very demeaning to them, and it would be sad. So if the student population is made aware of people with autism, the least that they can do is at least be sympathetic towards this child. So respite to families, whenever they need the help, they need a break, is something we provide on weekends and post-school hours. So presently our numbers are 103 students and a huge staff as close to 61, and a teacher-student ratio comes to 1:2. So we have been ranked among the best schools in Karnataka in the year 22-23, and also by awarded the first Excellence Award, Brainfeed School Excellence Award in the year 22-23 again. So we got introduced to Enabling Inclusion app same time last year, 2023. Kalyani Navamani and her team they were here, they were there at ASHA to provide us the training, and we actually started using the application in this academic year 23-24. For us, it has been a learning curve. We have been learning. It was not easy moving from a regular forming a particular assessment from normal development checklist to the year application. But I would say the team has been very supportive, and teachers also have been equally understanding and trying to move towards this application. I think this year we will actually understand how the graphs are developed, how the learning is going to be showed up on the application. I think the best part is all the reports, all the data about that student is available in one place and as a soft copy, whereas we don't have to keep piles and piles of papers, to check each and everything. So that would be the best part. And yeah, assessments are, since they are very standardized, it gives planning goals from the final developmental outcomes would be much easier with this application. So yeah, this is how this has helped. We are taking our time. We have some difficulties. I wouldn't say there's absolutely no difficulty, but I think all of us are working towards it. It's anytime we approach the EI team, anytime we approach Kalyani, this is an issue, this is a problem, we are finding it difficult. I think they are extremely fast, extremely ready to help us with it and, trying to customize it as best as possible for us. Yeah, so this is all about ASHA and our experience with the Enabling Inclusion app. So anything
Wonderful.
that you would like to know?
Thank you so much, Ms. Priya. Yeah, we have Amar Seva has learned a lot from working with ASHA, how to improve our app, how to make it more oriented towards a special school setting. So that's really helping us. I think there's a question from Deepa from Manipal.
Yes, ma'am. Yes, sir. It was a nice session and enjoyed listening to it, and seeing so many people involved with this app, using this app. I have a small question for ma'am, Asha ma'am. Just wanted to know whether you have tried incorporating or training the caregivers, the parents from the autism, which you're telling about the empowerment thing. So have you tried to use this app or or anything in your session, training the caregivers or training them to take care, for detecting or treating the children, like taking care of the children, empowering them in that per se, a module or something, a course which you can deal with the child?
As of now, we've been using this application more from the education perspective, education of students.
Okay.
Parent training is happening, but we have not used that in the application as such. I think that would be the next step. Let us get settled with, get used to using it on one front, and maybe we can do that. That's a wonderful way of look at it. But yeah, right now we are into training students all the data in the Enabling Inclusion application.
Okay, ma'am. And what do you think about your caregivers? Are they ready to accept it? You have seen a very, I was really impressed when you said about the empowerment thing, which you said, right?
Yeah.
So you think they have the potential to take up the course, if at all you're doing it in future, ready to do? Will they be able to take up, or it's a different level of people, parents, which are going to be in your team, which are there, the 106 patients which you're talking about, considering the entire population. So what do you think about it? Whether they'll be able to take up it or go ahead with that thing if it's been training for them?
Yeah. See, I think the child is the motivation for them, especially for the parents who come from the lower economic background. It is for their child that they're trying to do some things. And given the complexity of autism, I think one person has to just leave everything and focus on this child. So, and give very few numbers of vocational centers, many other difficulties where that is when the family needs to come into the picture. And yeah, the regular counseling, regular parent training does give them a path and an idea of what is expected of them and how to go about it. And I think parents also have their own network, so that also helps them in exchanging ideas, exchanging their plans, and that is also another reason why they are all able to manage this.
Thank you so much, ma'am. Thank you, Dinesh, sir, for this.
Yeah, thank you.
Yeah, Priya ma'am, thank you so much.
Yeah.
Good to know about ASHA and the work that you do. Where are you based out of? Are you which part of the country?
We are in Bangalore.
Okay, okay. And I also wanted to understand the model that you run. Is it like you charge the children for the treatment? Is it a monetizing model or is it like a non-profit?
Yeah, so it is non-profit. The government supports us to a certain extent, and we have CSR funding, so that helps us balance.
Yeah, because 1:2 ratio is like, very resource intensive. If there's no enough support, I think it's very difficult to maintain that ratio and run it. So hats off, ma'am, to the kind of
It's just a small client. The organization was started by our director, Jayashree Ramesh. So, and today she couldn't be here. So that is why I'm representing the organization. She started, and her energy, enthusiasm is just at its peak always. She's the energy behind all of us. So yeah, maybe everybody here is welcome to come and visit our organization, and we can always exchange ideas. Very nice to see all of you here.
Thank you so much.
Yeah.
Thank you so much, Priya ma'am. It's an excellent presentation, and congrats to the team for received that excellence award. And Jayashree ma'am also received a lifetime contribution award. Congrats, sir. Congrats, ma'am.
Yeah, thank you, Kalyani. Thank you all the team at Amar Seva Sangam.
Thank you so much. And I'm getting some messages that people are interested in learning more about the app, and we will definitely have another meeting and can give full demo to each team. So please reach out via email or WhatsApp and we can book those demos. Today is, of course, a sharing session. Our next speaker is from Shine Special School, Mr. Sajid Mohammed. Mr. Sajid, are you able to please share your screen and start the presentation? I can also share a screen if you need to.
Yes, sir, I can share my screen. Can you hear me?
Yes.
Okay, wait a second.
And this has been a good forum because there's a lot of people, from similar areas, like few Bangalore organizations and across India. So now we get to learn about each other. I hope people can connect with each other and meet each other and learn more. So thanks for the messages. Okay, Mr. Sajid, please go ahead.
Okay, wait a minute, sir. I'll share my screen. So can you see the?
Yes, we can see. Yes. Yeah, you can start.
Okay. Okay. First of all, good evening, everyone. My name is Sajid. I'm a physiotherapist working and representing Shine Special School. I'm proud to introduce my school. Can you see the presentation?
Yes, we can see the PowerPoint. Yes.
Yeah. Okay. Our school has established on the year of 2003 by 3 special children parents, which is running successfully for 20 years. In our school, we take all special children without any age restrictions and all disabilities except visual problems. Okay. Then our vision of our school is to give special kids the joy of schooling and childhood. And then you can see our management team on the screen right now. I have given the names of the trustees and everyone.
Mr. Sajid, you move to the next slide, please.
Yeah, okay. Okay, our main objective of our school is to identify and screen the disability at various levels and to give proper counseling to parents, family, and siblings to make them aware of disability and to educate them about the child and then training them according to
Mr. Sajid, only the one slide is showing. Are you trying to move the slide?
Yes, we are trying to move the slide, but it is not.
I can share the screen. Maybe that might help.
Yeah, you can.
I'll share the screen and let's see if that works. You just tell me when to advance the slides and we can share.
Okay, sir. Okay, let me start from the beginning. Hi, good evening, everyone. Can you move to the next slide, sir, please? I'd like to introduce about our school. Our school is established on the year of 2003 by 3 special children parents, which is running successfully for 20 years. In our school, we take all special children without any age restrictions and all disabilities except visual problems. And can you change to the next slide, sir? Our main vision and mission of our school is to set to give special kids the joy of schooling and childhood. Next slide, sir. Okay, you can see our management team on the screen. I have given the names of our managing team. And then next slide, sir. Okay, the main objective of our school is to identify and screen the disability at various levels and to give the proper counseling to the parents, family, and siblings to make them aware of the disability and to educate them about their children and train them according to the child's disability, and to induce and motivate the special child to do various activities. Next slide, sir. Okay. Services that are provided at the science school. First of all, we take assessment once in every 3 months to see the child development growth and to make new goals to all children that are studying in our school. We do periodical medical checkups to all children in the school with doctors like pediatricians and neurologists and orthopedicians once in 3 months. And we usually conduct a parents meeting at our school for discussing parents to show improvements and to take their valuable feedback and suggestions. There are various therapies that are provided given in our school, like physiotherapy, occupational therapy, speech therapy, and special education and vocational training. Can you move on to the next slide, sir? Okay, those are the pictures that are given at the school. Physiotherapy, and can see the occupational therapy given below. And next slide, sir. Okay, these are the other activities that are given at our school. And inclusive education. We take inclusive education, that is vocational training. We take children who are above age of 15, which is they do like candle making, sewing, and then lamination and taking xeroxes to make them independent and make them individual entrepreneurs. And next slide, sir.
Sorry. Okay, first, the program is executed along with the Reddington Foundation. The EA term in early intervention is the term to describe the services and supports that are available to babies and young children with the developmental delays and disabilities and their families. Okay, next slide, sir. Okay, the Shine has come forward to yearly intervention project along with Reddington Foundation. The EI bus is inaugurated on the October 6th of 2022. We first took 3 blocks, that is Melur, Madurai East, and Tripurangundram. There are more than 75 panchayats in there. Services which are provided in the EI bus are physiotherapy, OT, and special education and speech therapy. Can you move on to the next slide, sir? Okay, these are other services that are provided at our mobile bus. Okay, awareness program. First, we started the mobile bus early intervention program. We went to awareness to create awareness to the peoples on those 3 blocks from October 6th to November 15th, and records were kept manually at first. And 300 people were joined in the awareness, and more than 75 villages we went for awareness. And during last 1.5 years, we supported more than 26 children to get their disability card and UDID card with the help of the disability officer. And can you move on to the next slide, sir? And training program. In the date of November 15th in 2022, Amar Seva Sangam team came to our school and gave training about the EA app, which has on 3 days. On the last day, we went to field visit with them, and they gave explanation, and this is very helpful. They talked about the ATP, which is very helpful to prioritize our plan and treating the child, and the scales we use, that the WIFIM, then physiotherapy,
scale and GMFM, which is very helpful for us to assess the child and then plan the treatment accordingly. And then next slide, sir. And then we can set up the goal which according to the scale, how many sessions we need to give, and assessing and regulating the therapy can be done in the apps itself, which is very helpful for us. Can you move to the next slide, sir? Okay. From October 22 till date, we have enrolled 69 children in the EA app. In those, but we are currently seeing only 55 children, and 14 children were discharged from the app and they went to normal school. And we are planned monthly once visiting them and recording them annually. And by using the app, we can get the demographic data and assessment, evaluation, intervention, everything. And we can just upload whatever the documents they gave, the beneficiaries gave. And the activities which are pending, achieved, can be seen in the FTL dashboard, which is very helpful. And we can get the progress report either in the percentage or graphical module, which is very helpful for us to show to our partnership firm like Reddington. And can you move on to the next slide, sir? Okay. These are the beneficiaries list which we are seeing, those 69 children. You can see the list of disabilities we are seeing currently. Okay, next slide, sir. The KPI report. This report is very helpful for us. The Amar Seva Sangam team keep on sending us the KPI report every month, which is very helpful to regularize our work, and we can see what are the flaws we have. So this report is very helpful for us. And next slide, sir. The advantages of EA app while we are using. It is very accessible and manual work has been reduced, because before that we have just writing it everything on the papers and stacking it over, and which is very struggle to search what we need. So after we are using this EA app, which is very helpful for us, and the comment box, and during the treatment we can comment what are all the activities that are given today. We can comment in the comment box itself. And with this progress report, as I stated earlier, the progress report, which is very helpful for us to send it to the partnership, Reddington Foundation, and other government officials, and auditing report, which is and then while conducting the awareness, we can enroll the amount of how many participants there are on the awareness camp. We can enroll it in the EA app, and we can see it on the app itself. And then without internet, the app is working without internet. That's the main reason. As we are going inside the village areas, we don't have that much of internet. So the app can be worked without internet. Only the website needs the internet. So which is without internet working is a major advantage for us. Okay, next slide, sir. Future plans of our in special school. First of all, we need to make free transportations and free schooling for all special children, and to set up the hydrotherapy, constructing. Can you hear me, sir?
Yeah, you're audible.
Yes, we can.
Okay. To set up the hydrotherapy by constructing swimming pools for CP children's in our school, and we can see that from the beneficiary list, we have more number of cerebral palsy children. So in both in our school and both in our EA project. So constructing the hydrotherapy, which is swimming pool, will be very helpful for us. And we are planning to construct a synthetic playground so that our children can happily play. And we are planning and training our special children to participate in the upcoming Paralympics. And the next plan is to spread the early intervention mobile project to the next 2 blocks in and around Madurai, which is Tirupagundram block and Madurai West block. And here's our future plans. I think I summarized everything that I have to. And thank you.
Thank you very much. That was That was a wonderful presentation. And Shine School has, you know, from day one, when they adopted the app, they were using in a very high fidelity manner. They, you know, kind of almost did it perfectly the way they utilize the app. That's why their key performance indicators are all very high, as Mr. Sajid showed. So, and I also had the one lucky opportunity to visit their mobile clinic in Madurai and see the children come into the therapy bus and get the therapy, and it was a wonderful experience, and the parents were so satisfied and happy. So thank you so much. Is there any questions for the Madurai Shine School team?
No questions, but thanks, Sajid, for the detailed presentation. Very informative.
Thank you,
A lot of points, yeah.
Thank you, ma'am. Thank you, everyone. Thank you.
Great. Okay. If there's no other questions, we can move on to Mrs. Renuka, who's the principal of GV School. Mrs. Renuka, GV School, or is GV School here?
Can you hear me, sir?
Yes, we can
Hello?
hear you. Yes. Thank you.
Sir, screen sharing is visible, sir?
Yes, we can see the screen. Yes, thank you.
Yes. Very good evening, sir. Good evening to all. This is Madhavan, physiotherapist from GV School, Chidambaram. First of all, welcome to everyone who are participated in this webinar, and thank you very much to Amar Seva Sangam to give this opportunity to share our experience using Enabling Inclusion app. About our organization is an independent private charitable trust running more than 30 years in Kadalur district, Tamil Nadu. With the proper affiliation of Tamil Nadu government, GV Special School consists of 4 areas department with separate registration with government. There are 4 branches are GV Special School for mentally retarded, RN Susila School for the hearing impaired, GV Vocational Training Center for the differently abled, and Dr. KR Physiotherapy Center. First, early intervention. We know that early intervention means identifying and improving effective early support to children who are at risk of poor outcomes. Service of the child from birth to age 5. The benefits of early interventions: help children with disabilities, help families to manage child and reduce their stress, interact with normal children and inclusive therapy and inclusion with normal students and children in PUP school, and improve the quality of their lives. The importance of early intervention service can change the child development path and improve outcomes for children, families, and communities. Help the child and the family benefits from early intervention by being able to better meet the children's needs from early age and throughout their life. Enabling inclusion application. This application is very much useful for us and our organization and specialists to meet the children in the rural areas. There are various benefits of this early enabling inclusion application. Specifically, we have to tell that the assessment and evaluation allows for tracking the child outcomes and helps the intervention planning. First of all, we have to plan the children's therapy session. We must evaluation of the children is very much important. So in the EA app, the evaluation is detailed. The detailed report and the form of evaluation we have to, and validated protocols provide evidence-based therapy plans for each and every child and easy to understand. That means in very simple English language, not ridiculous language, ridiculous words. They are not used. Very simple language is very useful for the CRW workers and connects community workers to expertise and of rehabilitation specialist. Use the app has proven to improve worker satisfaction. Individualized therapy plans based on the child needs cover all developmental domains, cover children and youth from 0 to 24, improves their development in all domains, improve their school enrollment and integration, allows them to reach their true potential to enable inclusion. The main important, there are 11 models in EAM which are more helpful to our specialist and our organization. There are screening model. In the screening model, we have to screen the children in the community with developmental delays and disabilities. Service user and assessment model. The general assessment whose international classification of disability and rehab specialist assessment includes special educators and physiotherapists and speech and functional vision hearing assessment and autism ADHD. The separate assessment tools are very much useful for our organization and our mobile unit. And standardized evaluation tools like VFIM and other tools, valuable tools, are very much useful for our mobile unit. Treatment and intervention model. Automatically it is very much useful for us. Automatically the treatments are assigned in the app is very much useful for us. Dashboard models, the management can monitor where is CRW, where is specialist, where is special educator, can easily track the child and also the track the therapist and special educators. Reporting models easily report in 1 minute. We can easily print out the report of a particular child and what is the progression, what is the initial evaluation score and final evaluation score. We are easily track the scores. Training and awareness program model, track awareness and training programs and participants, pre and post test tracking available. GPS, as usual, GPS where we on manager console option, we easily find out where is the therapist, where is the child, what therapy given to this child. In calendar model, automatic as in an ATP, we say that ATP is very much useful for us, and ATP is in calendar, the automatic assign of the child is very much useful for us. And in geography, GB Trust and GB Special School extend assessment of early intervention 0 to 6 years. First of all, we starts into only 20 children in 2014 and 2015 onwards. And 2021 and 2022, Reddington Foundation support us the 2 special educators and a physiotherapist. From 2022, we screened from 2022 in current application. The total children joined in the program is 134 and current service user 52, discharged children 79, service users at the entry level 3, waiting list 23. Our unit visits 4 revenue blocks in our district, Kadalur district, Bhuvanagiri, Kirapalayam, Kumarachi and Parangpete. In Bhuvanagiri, 47 villages, Kirapalayam 64 villages, Kumarachi 57 villages, and Parangpete 41 villages. Types of children we have to treat are ID, intellectual disability, ADHD, autism, cerebral palsy, Down syndrome, hearing impairment, low vision, other orthopedic disorders, speech and language disorders. This is our services, awareness and early intervention services. In school activities in our school, I already said there are 4 branches in the vocational training center, one physiotherapy center, and RN Susila for hearing impaired. Finally, usage and benefits of the app by our organization. What are their detailed history of the child will be recorded in the application. Is very useful for us. Automatic assign facility available in the app. by the calendar model. It is very useful. Separate assessment format for individual rehab specialist, especially for physiotherapist and special educator and speech therapist, etc. Goal setting and specified intervention are available for corresponding impairment child, which is in simple English language. I already said to you, is a simple English language that is very much useful for village community workers. Very much useful. The project leader easily monitor the specialist and community workers activities through this application, such as location, therapy plan, therapy timing, comparison of evolution score between before and after therapy is very much useful for child monitoring and progression level. Thank you. Thank you, sir.
Thank you so much, Mr. Madhavan. That was very great presentation, and thank you for bringing up some of the points and that it was simple to use English language. There's also people can use the Google Translate function on the web app and get in the local language in Hindi or Tamil or Bengali or whichever language. And soon the mobile app will also be launched in all the Indian languages as well. That's a work in progress, but the web app has all the language availability. So just wanted to bring up that point. Any questions for Mr. Madhavan at GV School? You can type your questions, or you can unmute or put your hand.
Dr. Dinesh.
Yes.
Yeah, did I hear you say in all the Indian languages? Because we were looking mainly for the Hindi. During the presentation, we heard only it's in English and Tamil, if I'm right.
No, it's the web app will be in Hindi. Also, it's available in Hindi. It uses basically an interface for Google Translate. So it's all the web app is fully available in Hindi. In the mobile app, it's only English right now, but it will be soon available in Hindi also. Hindi and all the other major Indian languages, but that our developers working on that upgrade. Are you interested in the mobile app also, or just the web? Both.
We will start with the web app for the time being, because as like the community outreach is still not there. Once we begin that, probably we may have to go for that.
So with the web app, you can use in Hindi as of now.
Yeah. Thank you.
No problem.
Madhavan, is your mobile therapy van operational in Chidambaram? I saw one slide on Reddington giving you a mobile.
In 2022 to 23, I have a mobile bus.
Oh, okay. The same bus what the Madurai team.
Not available right now for our trust and school. Now only we have school van.
Oh, okay.
Therapy by van, mobile van.
But it has therapy equipments inside it, the van.
Yeah, we have that.
So, Mr. Madhavan, right now you're using the van to reach all the children. The van, the children are coming into the van.
Yes, sir. Yes, sir.
That's how you're reaching. Great. A lot of different delivery models. The mobile van and bus seem to be very popular, nice choices. We'll move on to our next speaker. It's Mrs. Nageshwari, the director at Feathers School. Is Mrs. Nageshwari there?
Good morning, sir.
Madhavan sir, can you please stop share?
Sorry, good evening, sir.
Yeah, great.
Yes. Forgive me, it is good morning only, no problem, ma'am.
Yeah. Very good. You can share the screen and you can start, or I can share that.
Pondichery ma'am, please can you share the screen?
I'll share. No problem.
Dinesh can share the screen.
I'll share here. Okay.
Some network issue. I can't start video. Sorry for that.
Can you see? Can everyone see?
Yes, sir. Yes.
Okay, good. You go ahead, please.
Good evening, everyone. Myself, Kartika. I work as a special educator representing in Feathers organization. First of all, happy to see you all here. Our huge thanks to Amar Seva Sangam for giving this opportunity to us. Overview of feathers. Feathers organization promoted in 2016. Our mission is foundation for enabling action to transform human excellence with resilience and self-reliance. Our vision is equality, equity, and humanity. Our core values are enabling excellence, equality, equity, and humanity. These are the overview of feathers. Next, domains of feathers. Our community-based intervention program name was we called Poontalir. Community-based early intervention for children with developmental delays in Madurai district, Tirunelveli block. இங்க வந்துட்டு பூந்தளிர்ங்கிற ப்ரோக்ராம் நேம்ல நாங்க வந்து ஒர்க் பண்ணிட்டு இருக்கோம் கம்யூனிட்டி பேஸ்டா. தென் வி கால் கற்க கசடர ப்ரோக்ராம். It's a remedial education for primary school for children with learning disability. இது வந்து 5 government schoolல நாங்க ஒர்க் பண்ணிட்டு இருக்கோம் மதுரை டிஸ்ட்ரிக்ட் திருமங்கலம் பிளாக்ல. பூவனம் program is called special education for the children with intellectual disabilities. That means age group 0 to 14 age groupல இருக்கிறவங்களுக்கு இந்த பூவனம்ல intellectual disability இருக்கிறவங்களுக்கு மட்டும் எடுத்து நாங்க வந்து ப்ரோக்ராம் பண்ணிட்டு இருக்கோம். In addition of our learning, Warnerville, it's an art integrated program. இது வந்து பிரைமரி ஸ்கூல்ல வந்து 3 months once வந்து art integrated like puppet shows, then art and craft, clay activities, இந்த மாதிரி வந்து art based வந்து நாங்க வந்து ப்ரோக்ராம் வந்து பண்ணிட்டு இருக்கோம். Next. Feathers, where we work. Feathers is working in Tirunelveli block in Madurai district. We have 2 center-based children in Virudhunagar district and Tirunelveli district. Virudhunagar district la Virudhunagar block la we have center-based work start பண்ணிருக்கோம். Then Tirunelveli வந்து community-based and center-based work and school-based work also we have started. That's earlier. Next slide, ma'am. Next slide. Legal status. Next slide. Okay. Totally Virudhunagar center-based work and Tirunelveli block. Totally we have 19 staff, like special educator, therapist, accountant, admin. இது overall இதெல்லாம் வந்து feathers team ஓட explanation sir. Next. Karka Kasarara, working children with learning disabilities, learning problems. இது வந்து school based program. We have 75 children enrolled in this program. 5 primary schools la government schools la வந்து remedial education நாங்க வந்து இந்த program வந்து பேஸ் பண்ணி பண்ணிட்டு இருக்கோம். Next slide. And the school details, government school details and children details. Next slide. இந்த டேட்டாபேஸ் வந்து ஸ்கூல் பேஸ்டா பண்ணும்போது நாங்க என்னென்ன இஷ்யூஸ்லாம் வந்து ஃபார்ம் பண்ணோமோ அதுல இருந்து நாங்க வந்து எவ்வளவு இம்ப்ரூவ்மெண்ட் வந்து கொடுத்துருக்கோம் ஸ்கூல் பேஸ்ட்ல வந்து அப்படின்றத பொறுத்து இந்த டேட்டாபேஸ் வந்து நாங்க கலெக்ட் பண்ணியிருக்கோம். நெக்ஸ்ட், இம்ப்ரூவ்மெண்ட் இன் தமிழ் லாங்குவேஜ்ல வந்துட்டு சில பிரைமரி ஸ்கூல்ல வந்து பேசிக் லெவலே வந்து சில்ட்ரன்ஸ்க்கு வந்து தெரியாம இருந்தது. அதுல வந்து நாங்க ரீடிங் வரைக்கும் வந்துமே இப்ப வந்து கொண்டு வந்திருக்கோம். நெக்ஸ்ட் சார், மேக்ஸ் ஓரியன்டா நம்பர்ஸ்ல. நெக்ஸ்ட் அரித்மெட்டிக்கல், இங்கிலீஷ், இது வந்து ஸ்கூல் பேஸ்டா வந்து நாங்க இம்ப்ரூவ்மெண்ட் காட்டியிருக்கிறதுக்கான இது டேட்டா பேசஸ். நெக்ஸ்ட், பூந்தளிர் வந்து கம்யூனிட்டி பேஸ்டு இயர்லி இன்டர்வென்ஷன் ப்ரோக்ராம். இது வந்து நாங்க லாஸ்ட் அக்டோபர் வந்து நாங்க ஸ்டார்ட் பண்ணியிருக்கோம் வித் அமர் சேவா சங்கம் சப்போர்ட்டோட. இதுல வந்து இப்போ வந்து நாங்க 100 சில்ட்ரன்ஸ் வந்து இந்த 2 monthsல ஸ்கிரீனிங் பண்ணி என்ரோல் பண்ணியிருக்கோம். சில்ட்ரன்ஸ் வந்து இப்போ வந்து தெரபிஸ்ட் எல்லாருமே சேர்ந்து இப்போ வந்து சாரி
What happened? You can continue.
You're audible. Please continue.
Yeah, we can hear you.
Okay. Thank you. 75 children 100 childrens வந்து நாங்க வந்து இதுல வந்து ஸ்கிரீனிங் பண்ணி கண்டுபிடிச்சிருக்கோம். அதுல வந்து மேக்ஸிமம் செரிப்ரல் பாலிசி சில்ட்ரன், ஆட்டிசம் சில்ட்ரன், டெவலப்மெண்டல் டிலே, ADHD இது வந்து ஸ்டார்டிங் வந்து நாங்க பண்ணப்போ எடுத்த அந்த டேட்டா பேஸ். பட் இப்போ வரைக்கும் நாங்க கம்யூனிட்டி பேஸ்டா போக ஸ்டார்ட் பண்ணதுல இருந்து இப்போ வரைக்கும் ஒரு நியர்லி 100 சில்ட்ரன்ஸ் வந்து நாங்க வந்து ஸ்கிரீனிங் பண்ணி வச்சிருக்கோம். நெக்ஸ்ட் சார்.
So the Feathers has just started the program recently. 27 children are been enrolled, but 100 children are waitlist.
Starting நாங்க பண்ணபோது எடுத்த database sir. First screening databases. Now we can enroll in 100 children in our database using EA app.
Great.
So what they are mentioning is in 2022 their number searched 27 children. Currently it is 100. Right, ma'am?
Right, ma'am.
Yeah, thank you.
Next slide, sir. It's also in the school-based rural areas issues வந்து we founded and then சென்டர் பேஸ்டு ஒர்க்ல வந்து நாங்க வந்து ரூரல் ஏரியாஸ்ல எந்த அளவுக்கு வந்து இன்டர்வென்ஷன் வந்து தேவைப்படுது அப்படிங்கிறத வந்து நாங்க ஃபர்ஸ்ட் ஃபவுண்ட் பண்ணி வச்சு திருமங்கலம் பிளாக் லைவ், விருதுநகர் பிளாக் லைவ் வந்து இப்போ வந்து 23 அக்டோபர்ல தான் நாங்க ஸ்டார்ட் பண்ணியிருக்கோம். நெக்ஸ்ட் ஸ்லைட். Center based early intervention, physiotherapist, occupational therapist and a special educator included. Next slide. Already explained for program Vanavil Art Integrated. We have 3 months once வந்து Vanavil programல வந்து அந்த 5 primary schoolல போயிட்டு இந்த மாதிரி ஆர்ட் இன்டகிரேட்டட் ஒர்க்குக்கு வந்து நாங்க ஒர்க் பண்ணிட்டு இருக்கோம். அது ஓரியன்டான இது. பப்பட் மேக்கிங், போட்ரி, five children are enrolled. Training next slide. Okay, next slide. Training and counseling. இப்போ பேரண்ட் இப்போ வந்து ட்ரைனிங் அவேர்னஸ் அண்ட் இது மாதிரி கம்யூனிட்டி பேஸ்டு இன்டர்வென்ஷனுக்கு வந்து நிறையவே அவேர்னஸ் வந்து இப்போதான் கிரியேட் பண்ணிட்டு இருக்கோம். அது வந்து ஏஐ ஆப்ல வந்து அது மூலயமா நாங்க பண்றது வந்து ரொம்பவே வந்து யூஸ்ஃபுல்லா இருக்கு. இப்போதான் அவேர்னஸ் ட்ரைனிங் எல்லாமே வந்து நாங்க 2 months once வந்து எல்லாமே சென்டர் பேஸ்டாகவும் கம்யூனிட்டி பேஸ்டு ஸ்கூல் பேஸ்டு இந்த மாதிரி எல்லாத்துக்குமே வந்து இப்போதான் ட்ரைனிங் ஸ்டார்ட் பண்ணி நாங்க பண்ணிட்டு இருக்கோம். நெக்ஸ்ட். தேங்க்யூ.
Thank you. So right now the early intervention program you're doing in the rural centers or home based?
Sir, I can't hear.
Yeah, are you doing the early intervention in the home based or in the centers are you doing?
Center based, both sir, center based and home based.
Great, wonderful. Thank you.
Thank
you.
Can I ask a question to her?
Yeah, okay. Absolutely.
Yeah, I can speak in Tamil. இது வந்து லேர்னிங் டிசபிலிட்டி எல்லாத்துக்கு ரெமெடியல் நீங்க என்ன பண்றீங்க? ஆப் யூஸ் பண்றீங்களா? எவாலுவேஷனுக்கு நீங்க தான் பண்றீங்களா? யூ ஹேவ் a separate system. எப்படி பண்றீங்க?
இல்ல மேம், இப்போதைக்கு நாங்க வந்து கம்யூனிட்டி பேஸ்டுக்கும் சென்டர் பேஸ்டுக்கும் மட்டும்தான் ஆப் யூஸ் பண்ணியிருக்கோம். இன்னும் ஸ்கூல் பேஸ்டுக்கு வந்து ஆப் யூஸ் பண்ண ஸ்டார்ட் பண்ணல. பட் ஐடியா பண்ணியிருக்கோம் மேம், எந்த மாதிரி வந்து ஸ்டார்ட் பண்ண அந்த ஓவர்வியூ எல்லாமே நாங்க வச்சிருக்கோம், பிளான் பண்ணி வச்சிருக்கோம். இனிமே இப்போ வந்து என்னன்னா இப்போ அடுத்து ஒரு 10 ஸ்கூல்ஸ்க்கு வந்து பெர்மிஷன் கிடைச்சிருக்குது மேம். ஸோ அதையும் ஆட் பண்ணி நெக்ஸ்ட் மந்த்ல இருந்து நாங்க அந்த ஒர்க் ஸ்டார்ட் பண்ணியிருக்கோம். ஸோ அந்த ஸ்கூலுக்கு ஃபுல்லா எல்லாமே முடிச்சதுக்கு அப்புறம் சேர்ந்து நாங்க ஸ்கூல் பேஸ்டாவும் பண்ணலான்னு தான் இருக்கோம் ஆப்ல.
ஆனா ஆப்ல இந்த சப்போர்ட் கிடைக்குமா? அசஸ்மென்ட்க்கு எல்லாமே இருக்கா? நம்ம தனியா வேற பண்ணிக்கணுமா? எப்படி இருக்கு எனக்கு தெரியாது. அது நான் கேக்குறேன் நான்.
ஆப்ல வந்து ஆப்ஷன்ஸ் இருக்கு மேம். சென்டர் பேஸ்டு, ஸ்கூல் பேஸ்டு, ஹோம் பேஸ்டு அந்த மாதிரி 3 ஆப்ஷன்ஸ் இருக்கிறதுனால நாங்க
அசஸ்மென்ட் ஆப்ஷன்ஸ் இருக்கு. ஓகே.
எஸ் மேம்.
Yes, ma'am. We have the learning disability assessments also in the application, so we can do that.
All qualified tools, right? It is like reliable,
Yes.
right? We can reliable on the tools. Okay.
Yeah, they're standardized tools that are validated, and also we have the permission to have in the app. For example, like we have the Madras Developmental Programming System. We have the permission from the authors in the app, the FACP, like that. There's different validated tools, but there's also some internal tools that some organizations, they have their own tools, maybe not validated, but we can put that in also.
Okay. Yeah.
Okay.
Great, Kartika ma'am. Excellent presentation. And actually here I have to record that the Feathers team doing an excellent job. They have enrolled recently. Within 2 months, they have entered a lot of data in the application. Nearly 100 children they have enrolled in the application. And their team is very dedicated and they are doing a very good job. Congrats, Feathers team.
Thank you, ma'am.
Yeah, it's one of our very new partners, so it's.
Yes, so thanks to Amar Seva. They provided field-based and center-based training for us. It's very useful for us. Thank you, ma'am. Thank you.
Yeah, we're happy to have supported Feathers, not just in the app, but also in kind of helping them launch the program and coming up with the way to run the CBR. So we're very excited to have worked with them on that. Now we can move on to our next. I think do we have from Miss Muthumalai from Dr. Soundaram Special School?
Good evening, I'm Muthumalai. Dr. Soundaram School.
Echo there's an echo. 2 machines are on. Yeah, I think.
I think maybe Ms. Muthumalai, if there's a second one on, just turn it off. If there's two devices.
Can you hear me, sir?
Yeah, now it's good. Now there's no echo. You can go ahead.
Muthumalai ma'am, நீங்க screen share பண்ணலாமா இல்ல தினேஷ் சார் ஷேர் பண்ண சொல்லவா?
Yeah.
Share பண்ண சொல்லுங்க.
Okay,
Yeah.
I'll do that.
Dinesh,
One
are you
second.
please?
Yeah, sure. One second. Yeah. Okay. Avvai Ashram, right?
Yes, sir.
Yeah.
Yes, sir. Yes.
Introducing my school, Gandhigram, Dr. Soundaram School for the Intellectual Disabilities, Avvai Ashram, Seva Sangam. Dr. Soundaram School under Avvai Ashram was established in 2010 in the school-based rehabilitation school. Centrally, 53 students are enrolled. The students are classified into 4 classes based on their IQ level: pre-primary, primary, pre-occasional, and occasional. Classification of the children based on their types of disability and skill. Sections: global development and early intervention. Number of children 1. Pre-primary 15 children, primary 12 children, pre-occasional 13 children, occasional 12, vocational based on spinning 1 children, tailoring and doormat weaving 2 children, basket making and jewel making 7 children, garden work and kitchen work, basket marking 2 children. Total 53 children. Number of the disabilities and skill. Changes like in our well-established school, we have departments of physiotherapy, sensory integration and gait schools, and model occasional activities such as your kitchen activities, making baskets, crafting jewelry, creating the floor mats, and selling handmade products with the proceeds directly deposits in the individual students' accounts. The sensory integrations rooms. Next slide, sir. Physiotherapist activities, physiotherapy camp, and special school sensory EI app regarding our record keeping. We initially faced challenging managing manual record. Realizing the need for improvement, we explored the EI application. After discussing this with our management, they approved our request. We collaborate with Amar Seva Sangam EA app team members, sending them our format, which they modified to create a customized application of our schools. Thank you so much, Amar Seva Sangam kit. It's very useful. This application has significantly cased the task of maintaining students' records, staff reports, and progress reports that have proven to be mutually valuable for our schools. Thank you so much.
Thank you so much. That was really good with some excellent pictures as well. Is there any questions for Gandhigram, Dr. Sandram Special School? So, Doctor, this organization is using the app right within their school itself. So, so we're seeing the different models, a lot of community-based programs, but this is one of the school-based programs.
They're just using for the record keeping and management, right? Of the mainly, I think it's a school and the skilling center, if I'm right.
That's right. Yeah. So actually, we did a lot of customizations for this school because they wanted to integrate the vocational training. And so we made a lot of vocational assessment specific to what they're doing. So they have basket weaving and jewel making, tailoring. So we made the specific questions based on what they're doing. So a lot of different customizations for all the very specific aspects. So they can record specifically what they're doing in their vocational training as well as their school as well. And actually they were using the MDBS tool, the Madras Developmental Programming System. So based on their input, we got the permission and incorporated that into the app and translated it into local language, Tamil language, and started using it there. So yeah, it was a great example of one organization where we required a lot of customization, and we were able to successfully complete, but it took a few months.
Where are they? They are in Chennai itself, or they are in some other place?
No, they are in Tirunelveli district, ma'am.
Okay.
Tirunelveli.
Tirunelveli. Okay. Nice.
Great. Now, any other questions, or next we can move on to PACT India. So this is a very new organization that is newly partnered with us organization that they just were in Amar Seva and had the training, and they have a very interesting model where they're working in orphanages and child care centers. So very excited to hear about their how they're going to be how they're running their program and how they'll be integrating the use of the app. So Merlin, are you able to take over? And
yeah, good evening, everyone. I'm here to present PACT India. Am I audible enough?
Yes, yes, ma'am.
Yeah. PACT stands for Prakyata Abhinand. Prakyata means important and Abhinand means acknowledged. And at PACT, we are here to acknowledge the most important children who are the orphaned, abandoned, and surrendered children with special needs. So we typically work with orphanages and childcare institutes. And this actually started with a personal story. And I and my husband, we were on the journey to adoption. And we wanted to adopt a girl child. We came across profiles of many children with special needs waiting for many years to be adopted. And this really broke our hearts. Professionally, we are physiotherapists, and it was a very unrest situation in our minds and hearts. And in 2019, we thought we have to do something about this. Let's learn about what happens to children with special needs who are inside an orphanage. So we ideated a model. We tried asking a lot of stakeholders on how this model would work, or if they could put in more ideas into it. And we started piloting a survey in 5 districts in Karnataka. And we found that they had an amazing shelter and food and clothing provided, but there was a clear gap in early intervention for children with special needs, and that was actually determining their course and quality of life, and it was actually hampering their quality of life. If these children were intervened at the earliest of their age, definitely they would have had a better quality of life, or they would have been adopted as well. So with the caption that growing healthy and having a vital milestone which is timely was something that we wanted to work, and that's how PACT began in 2020. And this is Chandan, you can see him on the screen. For like privacy reasons, it's the name change. But this child, if he was intervened at the earliest of his age, he would not have been a wheelchair-bound child. So in our piloting phase, we saw these problems. The identified problems where the care homes were non-conducive structurally, and also with skilled care people who could handle children with special needs, whereas these homes had a lot of children with special needs. And sadly, Karnataka stands first among the top 3 to station more than 4,000 plus children like Chandan who have special needs. And there are 992 childcare institutes across Karnataka, and Bangalore stands first in having 135 childcare institutes. It has the most number of childcare institutes. And at PACT, what do? We have 3 models. We screen, identify, and intervene children with special needs, and we empower and upskill the caregivers. We train, monitor, and certify them for as skilled, trained caregivers who can handle children with special needs. And we facilitate an inclusive ecosystem in the childcare institute where we build their infrastructure in such a way that they have a facility where rehab services can happen in-house. We operate it for 3 years, and then we transfer the skills to them to be self-sufficient. These are a couple of pictures of our interventions, screenings, trainings, and our sensitization to the caregivers and the organization heads. And just yesterday, we had inaugurated Inclusive Childcare Institute. We had set up their rehabilitation in-house in a government Shishu Mandira, which is a special adoption agency. It has infants starting from day 1 of their life who have been abandoned or surrendered or orphaned to children around 6 years or 7 years plus. And we have inaugurated and set up the entire rehabilitation system for them. So far in our 4 years of journey, we have screened 675 children, of which we have identified 304 children with various special needs in 12 domains. And 179 children are under our care and interventions presently. We have skill trained 35 caregivers, and we have certified one of the childcare institutes in Bangalore in a robust cohort program where a lot of parameters were monitored and evaluated, and they have stood first as an inclusive childcare institute, both structurally with skill-trained caregivers and also with the rehabilitation system they have for the children with special needs. And this is my team. We have a very encouraging and enthusiastic team on hand. And also we are backed with a variety of people who are helping us with governance as well. And yes, we have a lot of strength from our incubations, and we still have some ongoing incubation and organizational development skills that are being transferred to us. And our domain partners are the government of Karnataka. They have recognized our model and have allowed us to screen all the childcare institutes within Bangalore urban and rural. And we have program partners, among which Amar Seva is one of our recent partners. And we have the Good Sam Foundation. We are funded by the Azim Premji Foundation, Adyan Foundation, and also by Living My Promise. And enabling inclusion, we came across this around July 2023, when we wanted to scale up in numbers and also scale in depth for each child that we intervene. That's when I came across Amar Seva Sangam and this application, which actually technically it's an end-to-end solution. and it exactly fits into our model where how it helps us is it helps us to keep all the child-centric data in a very robust and a very confidential manner. Our data is very safe, and also their screening tools, their assessments, and the specialized evaluations, and the generated treatment that comes out, or the goal setting that happens, it's all placed. It's so planned that even if I translate the skill to a caregiver, it is easy for that caregiver to use. And it also helps, the application helps me to train caregivers in a very simplified way, because when it comes down to the treatment and the goals, it comes down to we can upload and also use the videos and the exercises that are set in place, such that the rehab workers and the community workers, it's very easy for them to use it, even in an offline and in an online mode. And how it aligns with our future plans when we want to build, operate, and transfer is when we build a childcare institute to be inclusive in their facility and in their skills. Later, when we want to remotely support them, this application is going to help us to keep the data and also keep track of, to monitor and also evaluate each child as they progress. And we are aiming to scale higher. It's not about the numbers. We want to scale higher as we scale deeper into each child's life, because this is not just about physiotherapy, occupational therapy, speech therapy, or special education. It also helps the child psychologically. It also helps us to track the progress of the child and also keep the data of the caregiver feedback. And there are many add-ons. There are awarenesses, training sessions. There's a lot of manuals that are built into the application, which is like a whole knowledge on a database, which helps us to work in a very efficient manner. And thank you, Amar Seva Sangam, for this beautiful application. We don't have to build it from scratch because you're already there and you have piloted it, you have modified it. And the best part is that they had customized it for our needs. And this was yesterday's event. We had just inaugurated the government Shishu Mandira rehabilitation setup. And thank you so much.
That's wonderful. Thank you. So in addition to working in the orphanage childcare centers, you're also launching an EI center as well?
Yes. So we have been providing the service of screening, identifying, and the team has been doing the interventions and the skill training for the caregivers. But now each of the orphanage that we are working in, we are trying to build their facility so that they have an in-house rehab center, an experience center in-house, because it's technically and practically being difficult that they transport the children from the orphanage to our experience center. So as a part of our learning, this was a new parallel that developed in 2023, that we have to enable and facilitate care home to be inclusive.
Wonderful. So each of the care homes will be having a center then?
Yes.
That's a plan. Okay, wonderful.
Each care home that we are working with, eventually we will build a center for them.
Right. So the one that you inaugurated is a care home for one of the centers. Is that right?
Yes. Yesterday was the beginning of it. Yes.
Wonderful. So that will be like a model for all the other centers then.
Yes. So yesterday was a very special day for Team PACT, because we just not inaugurated the experience center in the government Shishu Mandira. We had actually launched the EI application through our district child protection officer. And we have been awarded a recognition award yesterday for working for the children with special needs inside their centers.
Congratulations. That's wonderful.
Congrats, ma'am. Congrats.
Wow, congrats, Merlin. I think it's very, new, and thanks so much, Dr. Dinesh. I think this, we do run an adoption center, but I think this model is really scalable and wonderful. I just don't have words. There's a lot more to learn, I think, from you, Merlin. Thanks so much, Amar Seva, for
Thank
this.
you, ma'am. Yeah, we have heard about your organization from Celine, and we are looking forward to meet you sometime soon when we come down to Chennai. Because
Sure,
in our
sure.
future
Welcome.
plans, it's not just for Karnataka. Already our hearts are fluttering because we know the numbers that are sitting down in Tamil Nadu, in Andhra, and Telangana and Kerala. So before 2025, we want to pilot our model into all the South Indian states. So we already have started our data collection, and the numbers are very, very disheartening. So looking forward to meet you.
Always welcome, ma'am. Thanks, Dr. Dinesh, for this.
Yeah, this is a very, I think it's a very scalable approach. So I wish your team luck, and we're happy. I'm sure other organizations here would be happy to collaborate and work together to achieve this. Is there any other questions or comments for the
hi. Sorry.
Yeah.
Hi, Dinesh.
Hi, Shashwati.
Hi. So I just have a question for Marilyn. So hi, Marilyn. I'm Shashwati. I work with Shishu Sarothi, Guwahati. And first of all, I'd like to congratulate you for the great initiative which you are doing there. We do come across a lot of children from care homes who comes to us, children with disabilities, who comes there for, initial assessments and all. Some of them do get adopted, but we have seen there have been cases where, the children, they reach a certain age, and then they are taken to other care homes of, older age. And then we've realized there, the children, they don't receive this kind of intervention that that is needed for them in those care homes. So I just have a question, like, what do you do when, the children, they reach a certain age, let's say, they reach the age of 10, 13, 14 and beyond. So do you have some plans for them as well?
So yes, actually, our model is for 0 to 6. And typically we have a separate intervention model for 7 to 13 because they are also in the, there's a huge population of children who are also in an adoptable age, but still not catered to. So those are the children actually wherein they don't have the access to education because of their special needs, or they don't, because they start psychologically feeling the sense of abandonment. They have a lot of psychological and psychiatric needs. And they, and because of like typical neglect, and suddenly they are into like a typical government school after about 6 years of age. They struggle even with their basic learning because their basic foundation and individual attention was not given in the early years. So we do work with about 0 to 6, which is our strongest model. And we work for like maintenance and rehabilitation and progression. So we have these categories of mild, moderate, severe among the children whom we have identified, such that our individual rehab plan sets in according to the child's needs. So it's a very individualized plan that is chalked per child.
Right.
And we also have a model called EMC, which is Enmile Connect, for the children above 13 years, where we connect them to organizations who do skill development trainings. And we also connect them to organizations where assistive devices are required or higher end of psychological counseling is required.
That's nice. So definitely like to be in touch with you and learn more about the interesting work that you are doing, and maybe we can incorporate them in the work that we do. Thank you so much. Thank you.
Sure. Yeah. Thank you.
Thank you. We'll move to our next speaker, which is Mr. Shiva from Baptist Hospital, also in Bangalore, but working in many different areas. So Mr. Shiva and the Baptist team are new to joining our partnership. They have not started the EI app yet, but we've just signed MOU and they're coming. Are they there? They just finished the training, actually, I think. Are they training at Amar Seva? And so we'll let Mr. Shiva take over and talk. Thank you.
Hello, hi. Sorry, we don't have any presentation today, just having talk. Okay.
Wonderful. Great.
Yeah. Actually, we are from Bangalore Baptist Hospital. So I think you know that Bangalore Baptist Hospital started in 1973. It's governed by CMC Vellore. So in the year of 2014, I think we started District Disability Rehabilitation Center. So it's a collaboration project with the state government of Karnataka, or disability of empowerment of senior citizen department. So through the District Disability Rehabilitation Center, we are implementing so many projects, activities, for example, prosthetic and orthotic unit. So then the modification of footwear unit we are having, then early intervention, speech and audio we are having, then occupational therapy, then especially income generation activities for the PWDs, and especially one more activities like a modification of toilets. Those who are having a 75 and above, or those who are not able to sit, and so for those people, we are modifying their toilets. We are building new toilets for them. Then secondly, the newborn screening we started in government hospital. So then we started BERA also. I think in Bangalore, we are working in Bangalore rural district. Why we started BERA is like most of the children, they are going to for a video ID card or other diagnosis, they are coming to Bangalore. For them, very difficult to come to the Bangalore. Also taking one day kids to the Bangalore, I think they have to spend most of time there. Then huge cost also. That's the reason we started BERA in Devanahalli, Bangalore, near our airport. So then after that, recently we started the spinal cord rehabilitation home-based activity. So we are covering in 4 blocks of the Bangalore rural district. Then that caregivers training also we started. So recently we finished 3 batches of mothers. I think at presently those who are taken as a special educators, now we are taking to our job and we are given opportunity to work as a assistant special educators. So at presently in Bangalore rural, we started in a one center as a district center. So after that, we realized that I think many centers, many blocks, they can't access. They have to come to the main center only. That's why we started at presently 10 centers. We decentralized our centers in a block wise, taluka wise, and Hobli wise. Recently, I think last 3 months back, we started Hobli Center also. So yeah, then mainly then psychological unit also we are having. Then those who are having any corrective surgeries. So we are in the Baptist Hospital, we are doing corrective surgeries. Yeah. Then recently one more activities also we started learning disability. So we adopted 2 government school. We are working on that. So this is our profile. So sorry, we don't have any presentation today.
Yeah, Shiva, coming to the EI app, how long you have been using? Because it's a multidisciplinary, you have lots of projects.
Yeah, not yet. Tomorrow we are going to Tenkasi, so Amar Seva for taking training. So after that we have to use. First we have to explore how it will work. I hope that this is a great app.
Yeah.
And I think, Mr. Shiva, you're planning on using in the district, I think district rehab center to start, right?
Yes.
Correct me if I'm wrong.
Yeah. I think we start off.
You're going to start off with one district rehab center or multiple?
No, at present, in the one district itself, we decentralized our unit. We are having 9 centers. One more center is going to start. Totally 10 centers we are having within one district.
District. Okay.
Yeah.
So you'll be deploying the app to all 10 of these centers within the district?
Yes. That's the reason we have to train our special educators and other technicians.
And these are government district centers, right?
Yes, it's one of the model center. Yes, it's one of the model center in Karnataka. This our district disability rehabilitation center. There are 19 centers in Karnataka, but ours is one of the model center. So we got an award last time, one of the model center. So it's the state government itself.
Yeah, congratulations. And I think again, we're looking at scalable models. This could be a scalable model. If you're starting in one district, then it could be expanded out to other districts in the future as well.
Yes, sure.
Great. Okay. Any questions or comments for Mr. Shiva at the Bangalore Baptist Hospital? So next, we're going to go back to the Northeast, and we will introduce the Bethany Society. who is in Meghalaya, is Bethany Society. I think similar to Baptist, they have not started using the app yet. We will be going and doing the training in February. And I think they also don't have presentation, which is completely fine, but I think they will just be speaking to their wonderful work and how they're going forward.
Hello, good evening, everybody, and thanks, Dinesh. Greetings to you and your team. And also, I think, greetings to your secretary. It's his birthday today, isn't it?
Yes, it's 60th birthday, and there's a big celebration. So
yeah,
this was
so
a way of
greetings.
concluding our presentation, of course, but he couldn't attend because the celebration's still ongoing. So.
Yeah, and it's wonderful to be with you, to experience the diversity of the interventions across India. Actually, I had sent a presentation, but you don't seem to have received it. I had sent it to Porcelvi.
I saw the email, but then there's no attachment there on the email.
I sent it again.
Okay, one second. Let me check.
Check with Porcelvi.
Yeah.
I sent it again.
Okay, let me check. Porcelvi, do you one second.
Anyway, while you're trying to find it.
Yes.
I'll try and see if I can.
I don't have it. 1 sec. Let me just call Porcelvi.
It's on my desktop.
Yeah, we'll check, sir.
Sir, actually, there is no attachment. I called to Alvina, ma'am. She said we will present verbal.
No, I had sent it again at about 3:30 in the evening.
Yeah.
Porcelvi, can you forward that to me, or Mr. Carmen, are you able to share?
2 minutes, sir. Let me check. 2 minutes, sir.
No, okay. Anyway, if you're trying to, and unfortunately, my camera is not working, which is probably a good thing that you can't see me. I have it on my desktop, so let me see if my camera is not working. Can I share the screen?
Yeah, you should still be able to share screen. If you press share screen, it should come. Yeah.
Just 1 minute. I'll try and.
Ma'am, I didn't receive. There is your logo only came, ma'am. There is no PPT. I see.
At 3:30. Yeah. Okay.
But 3:30.
Let me share my screen.
Yes.
Can you see it?
Yes, we can see. Yeah. Yeah.
Oh, you can see. Okay.
Wonderful.
Okay.
Yeah.
All right. So good evening again, everybody, and welcome. This is Bethany Society. We are located in Meghalaya, which is in the northeast. We are friends and partners of Shishu Sarothi in many programs. And this is just to show you that ours is a combination of both urban and rural. I also want to say that we are actually a mainstream organization, which is 41 years old. And we have embraced disability as one of our core programs. So we have a program in Shillong, and then in the rural areas, we are spread across most districts in about 600 villages. And so that is I won't talk too much about the organization, but the reason why we wanted to collaborate and partner with Amar Seva Sangam, one is we felt that we were part of their family, and they have been so helpful. And ours is a very vast program. And I think a time has come now that we need to be more accountable, and ICT is the way forward, both to our clients, our parents, our funders, to the government, etc. And our major focus, so this is it, and as a organization, Bethany actually means that if anybody comes to us, they should be happy and be able to cope with stress, irrespective of their their personal challenges. So this is one of our programs that we have for adult persons with disability, training them for employability. And this is a wonderful natural photograph. This is another picture of our children. And we do not have a special school. The focus of our work is on inclusion. We believe that our way is inclusion. And we believe that we should mainstream. So all children, we say they must follow the curriculum, the state curriculum or the central curriculum, but the way they achieve it could be quite flexible. So this is our school program, which is an inclusive school. And that's why we were very interested. So we have about 350 children, out of which about 80 children are children with disability, cross disability. So children with autism, learning disabilities, visual impairment, hearing impairment, deaf blindness. So they all study together because they are children. And so one of the challenges we have is that can the app, maybe it might not be useful, but can it track all children, all 300 or 350 children in the school? So that is that's one challenge. So we have inclusive sports and all sorts of stuff. And so we were started in 81 for mother and child. And so that is our focus. And in the last 5 to 6 years, we have gone back to early intervention in a very strong way, and early intervention of all children. So if you go into a village, we try and screen all children 0 to 3, and then look at children at risk. But that also leads to ownership within a village. So whether it's livelihoods or anything like that, we focus on all. And so this is our rural center in the Garo Hills, and that's our motto. And so we work very closely with the environment, livelihoods focused on environment, and that is another question that we have, because we work with persons with disability right up to the age of 55, 60, and we want to know whether we can track them. And so our parallel program to education is livelihoods, and we call it building soils and communities, because it's in the Northeast. It's very, very environmentally fragile, and we are looking at food security and how do communities in the soil and communities among humans can we collaborate for a better future. So this is some of our work where we do purely on natural farming and work on livelihoods. And so this is the extent of our, this is Meghalaya. We work specifically in Meghalaya and through partnerships in other areas. So specifically for people with disability, we're working with about maybe nearly 4,000 families and another 3,000 families who have experience of mental health, mental illness. So we are scattered across, and wherever you see these little groups, these are the places where we have our interventions, not necessarily, and they are all rural, they are not institutional. So working with the government and working in collaboration with the government is our major focus area. And we are hoping that this app could then work with the government program on disability. And this is not important. And our major focus is how do we break barriers and open doors for mainstreaming? So it's not only presence, it's also participation and it's performance. And I think for us, I mean, I've studied it a little bit, the app will encompass all these three areas, the presence, the participation, and the performance, and it will give us evidence-based, credible data. That's our belief. We are still very, very young into it. And as far as education is concerned, this we feel is a huge program. I mean, it's a huge problem for children. And if you want to know my name, so that's my name, you won't forget it. It's Carmo. But I'm not as bad as that car looks. But that is the system. And I do hope that the app will look at the system. And so what I want to say, yes, we are confused as far as the data is concerned, putting everything together. And I do hope that February will be a wonderful month for us. We are truly interested. And as the little child says, the more I think, the more confused I get. So that's it. So how do we make sure that our children and our adults get the 5 most important skills for the 21st century, which is collaboration, communication, creativity, compassion, and critical thinking. Thank you very, very much. That's all I have to share. Thank you.
Thank you, sir. Excellent presentation.
Thanks. That's really wonderful. And our team will be there in February, so they'll see you in person. So you don't have an opportunity to turn the camera off. They'll have to see you in person, Mr. Carmel. So
yeah, as I said, maybe a good thing tonight.
Yeah. So that's really a great, very comprehensive program, and we're excited to be able to work together. Any questions for Mr. Carmel?
Yeah, it's just a curious question. So why do you want to track? I hope I can call you sir, because they were somewhere
No,
addressing you
don't
as
call me
ma'am.
sir. I mean,
Okay.
Yeah.
Yeah.
Carmo is
so,
my name. Carmo. Yeah, think of a car. Yeah.
Sure, Carmo. So why do you want to screen all the children? I'm just curious.
The reason why we want to screen all the children is we don't want to duplicate work. So the children with disability will be in the EI app, and the other children, because in a classroom you might have 5 children with disability and you might have 15 children without disability. They're all
Correct.
studying together. So we were just wondering whether it was possible. I know it will waste space, etc., and so on, but it will make the work more comprehensive. And then I think we can also then compare data. I mean, that's the only reason that we wanted it, so that it would reduce drudgery and duplication, like separate for children with disability and separate for children without disability. That's the only reason. I'm talking about academics.
Got it.
Yeah.
So they have been like this in the same school from the beginning, the special and the regular children. Inclusivity is happening for how long now?
For the last 16 years.
Okay.
Yeah.
So you have special educators on the need basis for the children, or the whole class is learned in a different way, at their own
No,
pace
we
and
use
mode?
as Ketaki was saying, we work together on the universal design of learning, and we use that for training teachers. But we have special educators. We have special educators. We have for the disabilities, for autism, for intellectual impairment, for hearing and speech impaired, for visual impaired. We have special educators, and we have educators who have got general B.Ed also.
Okay, got it.
Yeah.
Thank you, Carmo. All the best. It's a wonderful project. Thank you so much for your time. Lovely.
Thank you. Yeah, Ketaki wants to ask something.
Yeah, I just want to say hi to Carmo, and also, I mean, as the conversation is fanning out, I can see that, and I've asked for some, typed in some comments in the chat box also. I can see that this is going way beyond early intervention. The potential of the app you're enabling inclusion. I mean, it's going across, from childhood to adulthood, across different needs, across education, across vocational training, and so on. So, yeah, I would also like to rethink
Our
very
ultimate
interesting.
aim, Ketiki, is to introduce this to the government, because the government has a huge program in Meghalaya with multi-purpose rehabilitation, CBRWs. And we are actually training their workers, the same course that you are doing.
The
So our
CBI.
ultimate aim is that if the government adopts it, then there will be no duplication. And then, across Meghalaya, you could.
But this app is disability specific, isn't it? Dinesh?
Yeah, disability specific, definitely. But it does cover all age into adulthood, vocational. So as you've seen in the presentation, some people are using for vocational training.
Yeah.
We're using for older children now, school age, definitely. We haven't deployed it for people without disability. Of course, screening, yes, we have the screening, so you can screen all the children. But it can act as a database. Like, it can be a database for whomever you want it to be, and it's customizable, and so it can be deployed that way. So it'll be interesting to see how things work out with Bethany and how things roll out. But as of now, it's been a disability specific software.
Okay.
Yeah, on a lighter note, wish Karmo, you were our teacher.
Yeah.
Why is that?
No, the way you put across your name and all that. So it's when we had a schooling and all that, right? So it was very different. So it was just a thought which came in mind. I openly shared just for a lighter.
Yeah. Thank
sharing.
you. Thanks. Thank you. Yeah.
Karmo, I have a question. So the school you're talking about, this is the school, Bethany Society School, or are you talking about the schools across the state?
No, I'm talking about hope that if it works, then we can multiply the mission. I mean, the focus is the cause, and how can we multiply and have credible quality data?
Right. So you're talking about starting in the school and then expanding out.
Yes, exactly. Yeah.
You'll have to pilot it at Jyotish Road, I guess.
Yes, correct. We will and for the livelihoods in our skill development unit. Yeah.
So our team's coming out to Northeast in February. Ketaki, when we're out in Shishu, the team can show you some of the other things as well, like in addition to training on the transmission, so you can see more.
Yeah.
And
I had one question for Karmo, but the RBSK scheme of the government runs there also, right? They
Yes,
basically
that's right.
screen. So will you be not duplicating the work that, or is there any question around that?
We have tried. They're not working, as well as they should. But when Dinesh's team comes here, we are looking forward to interacting with the Principal Secretary, Health, Social Welfare, and so on, to perhaps look at that. And these centers are in towns, and the 80% of the population is in rural areas. They never reach there. So we don't take a cluster of 30 villages and have 6 field workers living in the villages. They are from the villages, so they can move out and community-based, home-based, etc., visit local schools. But I love the concept of the mobile van and the mobile bus. Ketaki, I think that could really help us out in some of the areas if we could have funding. Yeah. I mean, I think that's
Chennai. Welcome to Chennai to see our project.
Yeah,
both
we've
Ketaki and Karmo.
I'm looking forward to visiting Chennai. Definitely. Yeah.
We've started a mobile service, but it's not a equipped vehicle. It's just
that's
like the
nice.
Satya special school thing where they use it to travel, basically.
We can also share all the information, all the design of the bus and all that.
Yeah, that would be useful.
That would be tremendous. Yeah.
I know APD has a bus also called Rehab on Wheels.
Yeah.
In Bangalore, which goes out every day to
So, Carmo, you're doing the home base now, and when you talk about
yes, we are doing specifically home based at the moment in the rural areas, except in Shillong.
Yeah, when I visited the Chennai project, Varshini, Illam, the slums, the roads are, they're very narrow, right? So they park at a central area and bring the children from the home into the van. So it's a very good bus, actually, I should say, not van. It's a very good concept. It's expensive, but I think there are certain funders that are interested in that, interested in funding. So that's also something that as a group we can collaborate and talk about, like which funders are interested in funding these kind of vans and such, right?
We need to know more about
And also I can give information because see, funding always can happen, but at the end of the day, it has to be operated by us. So the operating cost, and it's a very resource intensive process. So per child, per month, the amount is going to be very high because, the bus has to run, there's petrol, there's diesel expenses, there's maintenance expenses and all that. So all that information I can share with you so that, you will have an idea. That's something that we already have as an information. We're running this for the last 1.5 to 2 years. So we can share that with you so that you can probably decide on. And a lot of organizations I've seen, they build the equipments in a tempo traveler, but tempo traveler actually takes a lot of space because of the kind of round this thing that they have inside for the wheel. So we basically took a bare chassis from the manufacturer and built the bus on it. That's why the cost of the bus was high, but it actually reduced all these non-utilization of space otherwise. So all that I can share with you.
That'll be nice, really useful.
Yeah, what we'll do is, we have WhatsApp groups with each organization, but we can start one shared WhatsApp group with all the partners. So a lot of exchange of ideas is coming out today. So it would be nice to be able to share some of these things. And I think people like WhatsApp to communicate, so we can try that as a modality. So we're coming near the end. We have one more presentation. It's actually from Amar Seva team. Navamani will be talking about how Amar Seva has been deploying the EI app over the last few years. So Navamani, are you able to share screen or?
Yes, sir, I can share the screen. Can you see the screen?
Yeah, we can see. Thank you.
Yeah. Good evening, all. I think most of you knew me by the training and other things. So today I'm here to discuss about my experience as a lead for the implementation and capacity building with an Enabling Inclusion app. So quickly, Amar Seva Sangam projects can be classified into two. One is the village-based as well as the center-based. So village-based, we have early intervention program and the school age program and the livelihood development program. So in that early intervention program is the one which started using the early EA app from 2014. The other program started using the app only in the 2021. We have the livelihood development program for the adults, but it is used in only for the tracking of the staff. The other contents are getting ready, so it's not yet fully developed. So the ASHA campus program are the Sangamam Special School and the residential program for children with disabilities and Seva Saraswati Vidyalaya Higher Secondary Schools, vocational training centers. All these programs started using the EA app from 2022 onwards. So the impact of the EA program monitoring on the quality of the programs is the general support. I'm sure that all the rehab professionals would agree that we focus more on giving therapeutic services to the children than doing the record and documentation. Using this app helped us to streamline our record keeping and reduce the documentation time. So when we are taking the progress report of the children, we usually do the manual calculation, which is reduced by using the EA app. So it has reduced the time of documentation. And the assessments, evaluations, and the program planning is all seen. That's each one child's assessments, evaluation, and everything are seen by all the professionals. So it leads to a lot of collaboration between the professionals compared to using the without app. Another one thing is we are able to see a clear overview of completed session. For one child, we know like different professionals working with the child. We have different goals and have different visit compliance like sessions, but we are able to see how much the child that's how much the session has completed for each child. So apart from the general support, the other things which we are able to do from the app is it fastens the various steps in the program. See, our early intervention program in one district itself, we are covering more than 1,250 children. So the process starts from the developmental screening, assessment, till the preparation of the intervention plan. And in that, different rehab professionals have different roles. So without EA app, it would be very difficult to monitor whether the children, whether the steps are being followed and each one is doing their work. So it helps us to move the steps from screening to the intervention. And we also do the periodic evaluation for the, somebody is moving the, yeah. So we are doing the periodic evaluation for all the children, like with the 1,250 children with 40 rehab professionals, making sure that everyone is doing their job. So which is possible only through the EA app. Just 1 minute. So all the villages and wards are listed in our EA app. So it helps us to monitor whether we reach all the villages. So in a district, there will be a lot of villages. Whether we are able to reach all the villages, we ensure through the EA app. So we plan our regular programs like screening programs and awareness program through the list we have. And also we also check whether any children are missed out. Suppose if there is no service user in one village, we ensure whether it is because of there is no need or some other reason. So that's another help from the EA app. So it also helps us to understand the staff difficulties. So suppose one staff have prepared like 100 visits in a month. So sometimes they covered 80 and sometimes they missed some 10 or 20 visits. So we usually don't take that it's okay, it says 80% it's covered. But when we analyze the reason for the cancellation of the visit, it was mostly the long distance, means the community worker have to travel a long distance, or it is a poor access, there is no bus facility or non-cooperation. So when we understood the pattern of cancellation of the visits, then we could better discuss with the staff in designing their the day and planning their day. So it helped. It lead to a lot of collaboration between the staff so that we can better implement the program. So review of child data, since the information about the
move இருக்காது அந்த picture மூவ்லாம் ஆகுது அது
இல்ல present mode தான் போட்டுருக்கு.
இல்ல present modeல இல்ல.
Yeah, now I have moved it. Yeah. So all the data like assessments, goal setting and evaluations are all available at our app, and it is available in the mobile app also. So anyone who goes as a monitoring person to the field, they can actually check and cross verify with the children. So that is possible with the EA app. And also recently we have a lot of donors or the funding agencies. When they visit our organization and they visit the field, when they do the field visits, they also check the assessments because earlier the monitoring people coming from funding agencies are more social background. But I see in the last 2-3 years, people who have specific technical knowledge like physiotherapists, facilitators, or the occupational therapists, when they come as a monitoring person, they cross-verify, cross-check whether our assessments and the intervention plans and goals. So it gives more kind of, they're satisfied with the reports. So they see, oh, okay, it gives more authenticated reports. So it has a good reputation for our funding agencies also. And reports to donors. Since our program is a big program, different funding agencies and donors supporting us. Each one would be requiring different data.
Yeah, I thought it's my connection. No, I think she's.
Yeah, okay. What I could do is, no, I think now money is off completely, right? Let's see if she joins back.
Somebody has to call her. She will not even know. She's not on the.
Yeah.
Sorry, happens to the best of us.
Yeah. It must be some connection issue. She's probably at home. I will finish the presentation for her since I don't know about her connection. Now, which slide was she? Do we? Oh, yeah, she's here. Yeah.
Yes.
So this is her presentation, but I have it, so I'll just try to speak to it. But it allows for report to donors. Like specific child reports can be created, including the age, the gender, location, screening data, awareness program data, the number of visits the child had, the child's progress over the various domains of development. So this is really helpful because some donors are sponsoring individual children. That's how Amar Seva raises funds. So that helps quite a bit. It also gets the attention of the management on important matters. For example, in our vocational training center, the visit rates were really low, and there's a high level of dropout that was detected. And it was turned out they felt their salary was low. So, we're able to identify these issues and try to address them. So we have follow-up on assistive technology, school admission, government schemes. So like we saw the UDID cards were very low. The unique disability ID cards were quite low for children in certain areas. So we started running camps for help them apply and obtain the cards. Assistive technology, we have assistive technology program, but we also connect them with the government schemes like the SSA schemes. So the tracking of all these services and the customized reports is very helpful in identifying which children need follow-up with certain government schemes or certain benefits. Staff performance can also be verified, like the number of visits that each staff is accomplishing or not accomplishing can also be seen.
Dinesh sir, I have joined.
Oh, you're back? Okay.
Yeah.
Do you want?
Sorry.
Do you want to share screen again?
Yeah. I cannot share the screen, but you can share the screen. I can.
I'll continue and you talk. Yeah. Sorry. Yeah.
Yes, sir.
Okay. Right. Yeah. Shall I go to the next slide?
Yeah. Yes, sir.
Yeah. Go ahead.
So our EA app has a lot of data. So we are also doing a lot of many research. So we are able to take the reports for the data for the research, and we have the ID. The system creates the ID for each child. So we are able to give the data without the child's identification details. Next slide. As a implementation lead, this EA app has helped us to do the self-analysis. So as a team, we are able to check how we are doing in our program with respect to the children's progress, with respect to visit compliance. It also helps us to identify the gaps at the individual level, whether it is at the manager level, whether it is a staff level. And also it helps us to communicate the difficulty. Suppose if one person didn't perform are not up to the mark, then how it affects the entire program. So it helps us to do the communication with the staff, and it also helps us to give the scope for further improving our program. Next slide, sir.
We talked about that.
And so use of the EA app. So when we started using the EA app, so entering the data is only the first step. But how we are using the data is very essential. So we can improve the program only when we start using the data, and the quarterly performance report, which is sent to all the programs, is very important. It's a very big support so that we are able to cross verify, check, and move forward. Thank you so much.
Thank you very much, Navamani. Any questions for Navamani? about Amar Seva's use of the. So in our in the Amar Seva programs, there's various programs using the app. There's the center-based, the special needs school, the home-based programs, CBR programs. In total, we have more than 4,000 children enrolled. So there's a lot of data, a lot of support that we're providing even to our team for the performance reports, the summary reports, and so they found that quite helpful. So this program is, of course, we're working with other NGOs, but internally also, it's been quite useful.
Yeah,
this is our
Dinesh?
last present. Go ahead, please. Yeah.
No, I just wanted to thank Navamani for making it look so simple. Thank you so much. I know it's, but you've been using it for many years, and we hope we will have access to you to support us. I think it was a great presentation. Thank you.
Thank you, sir. See you soon in your next month.
Thank you everyone for patiently being here. I know we had a bit of dropout because it was a long day, but I think this was designed to be a sharing session and interactive. So I think it's good. It's fine that it went a bit longer. I think Mr. Rajesh, who is our Chief Operating Officer and Financial Officer at Amar Seva, is just going to say a final word of thank you before we conclude. And then maybe everyone can turn the cameras on. We could take a little screenshot as well. I think, Kalyani, I don't know how to do, but maybe you can do, or someone from the you can do it. So if everyone turn the video on, if possible, that would be appreciated. Thank you. And you can go ahead, Rajesh. Well, we'll do that.
Yeah. Thank you everyone, and it was very pleasure. Actually, we are very happy to see our partners in one place. Of course, it's a long session, but a lot of sharings. That's the most important one, and we are happy to have you these kind of discussions. That this is the dream of Amar Seva Sangam, to have a collaboration with the partners who are all very interested in these fields. We would like to share our knowledge, and we want to learn a lot of things from others. So it's very wonderful, and we are happy to have this. And thank you so much for all the participants. And definitely we have to wish our Amar Seva team for these wonderful efforts, and the partners who are all the major key role players here, because they are all the team who makes this program as a successful one. I cannot say one because everyone are doing their best, and it is also see, we have thinking about this home based and center based and hybrid models, so and mobile vehicles. So it's an excellent one. And we would like to have these kind of sessions quite often, at least once in 6 months. It should be a great helpful for us, because anyway, the team are closely touch with each and every team on even daily basis. But these kind of discussions would give you a detailed knowledge sharing is most important in this. And a lot of questions and a lot of clarifications are most important things. And happy to have the networking is the most important one in nowadays, because we can have a good networks in this. So thank you so much. I cannot say that every person's name or the institution's name, but we would like to we would like to thank each and everyone from Varshini, Illam, and Satya School, because Varshini, Illam are very keen to implement the program from the beginning. They are the people who are all with the very good supporters from their top management. They are all very into people to have discussions. So thank you so much. And of course, Satya School, because we have learned a lot of things from them. And Shishu Sarothi, ma'am, she is the senior, and she's supporting a lot for development of this application and support system. And ASHA, Science School, GV School, and Feathers, and our near schools, Soundram Special School, and PACT India, Baptist, and Bethany. Actually, Prashanti, the only team, couldn't join the meeting. But of course, they just started in the last month. So in the next meeting, they will do their best and come up with their own logic. They are also doing a wonderful job in Coimbatore basis. So they are also planning to implement the program in field as a community-based program. So they are waiting to roll out the program, I think, in March or April onwards. So thank you so much for everyone for this wonderful session. We would like to invite all of you because most of them have experience in Amar Seva. So who are not yet visited, please visit to our organization. It would be a great, for us to host you and share our knowledge with you. It would be a very good experience, definitely to you also. We invite all of you at your convenient time to have a visit, and of course, we can also plan a session in person. That would also be a good one to have the brainstorming sessions to make it in a further heights. So thank you so much once again. Thanks from our Amar Seva management team and our Center of Excellence team. Thank you so much for your work. Thank you.
Thank you. Thank you so
Thanks,
much.
everyone.
Thank you. Thank you.
I hope.
Yeah.
Thank
With
you.
Shankar Raman sir, personally from our end, a very, very happy birthday. We're remembering him today.
Yeah. Thank you, ma'am. Thank you.
If you are there in Tengashi, please straight from our heart to him.
Definitely. We will convey your wishes to
We
him.
couldn't make it today, but please send our wishes. Yeah.
We can plan, ma'am, because one training was conducted by Navamani in the last month. So the next we can plan it in Tirkasi.
Sure, we'll come over, sir.
Yeah.
Okay.
Okay, thank you.
Okay, should I close out? Okay. Kalyan, you got a
Thank you
screenshot?
all. Yes, I take.
Okay, wonderful. Okay, thanks, everyone. Okay, bye-bye.
Thank you, bye.
Thank you all. Bye-bye.
Thank you. Bye.